Good afternoon. Thank you for joining the Finance Committee. Today is Wednesday, February 5th. We only have 8 bills today. Right, Tammy? 8. We're down to 8 bills. Thank you. I'm Pam Vidal. I'm Chair of the Senate Finance Committee, and with me is my Vice Chair, Senator Antonio Hayes. And I want to introduce our newest Senate member. For the first time this year, we are at full capacity. So, Senator Carl Jackson, welcome to the Finance Committee. We're very pleased to have you. I'm going to read the order of the bills. Now, things can change. You're going to see some of our senators get up and leave. They're going to other committees to testify. If we get to their bill and they're not back, we'll just skip to the next bill. It's all very fluid in the Senate Finance Committee. Our first bill today is Senate Bill 303, Senator Lamb. If you want to go up and get started, Senator. Then Senate Bill 3, 374, 372, 355, 119, 279, and 314. Senator, do you have a?
Yes, we have
Kelly Locklear and Michael Patty.
Michael Patty.
Thank you. I just want to remind you the sponsor has as much time as he needs. All the witnesses have 2 minutes. Thank you.
All right. I'll use that Senator Kramer luxury of time. And welcome to Senator Jackson. So good afternoon, members of the committee, Chair Vidal. I'm here to present Senate Bill 303. For the record, Clarence Lamb, Senator in District 12. So Senate Bill 303 seeks to extend the coverage of many of our state's insurance regulations. Currently, most of our laws are limited to the relatively small individual group market. This is because it was previously believed that the small group and also the self-insured policies were off limits to the state's ability to legislate over it because of a 1974 federal law called the Employee Retirement Income Security Act, or more commonly known as ERISA. However, a few years ago, in 2020, the Supreme Court of the United States took up a case out of Arkansas called Rutledge versus PCMA. The court there unanimously upheld an Arkansas law known as Act 900, which required pharmacy benefit managers, or PBMs, to reimburse pharmacies at a price equal to or higher than what the pharmacy paid to buy the drug. In short, the court ruled that if the state laws do not interfere with the plan's design, that the laws themselves can apply to policies formerly believed to be so-called off-limits to state law. So to be applicable to these policies could fall under state law jurisdiction. Maryland has many important patient and pharmacy protections, including prohibiting PBMs from limiting pharmacists' ability to discuss price with patients and prohibiting PBMs from requiring patients to go to pharmacies owned by the PBM. However, because our laws were drafted based on an interpretation of ERISA, which has since been superseded, these protections only apply to less than 20% of policies in the state under our prior understanding of the law, which, as I mentioned, has now been reinterpreted based on the Supreme Court. The protections extended by this bill are not arduous or complicated. They have been tested in our state with thousands of policies that are an individual group market where they have always applied, and also in our own state employees' health insurance plans. The PBMs continue to make the case that provisions of this bill are preempted by ERISA, but would like to draw your attention. In your packet, there should be a letter of support from the Maryland Attorney General's office and also a letter from the Maryland Insurance Administration stating that the bill is legally sufficient. There is also, I think in your packet, or we can supply it to you, an amendment that has been added to the House cross-file version of this bill, which we are supportive of. This would require the Maryland, in addition to keeping the provisions of this bill, this would add to that a requirement that the Maryland Insurance Administration conduct a work group to examine specialty drugs and anti-steering as well. And so hope to have a favorable consideration by this committee, and happy to turn it over to other members of the panel.
Good afternoon, honorable members of the Senate Finance Committee. For the record, Kaylee Locklear here on behalf of the Maryland Association of Chain Drugstores. So we come to you year over year because the current pharmacy business model is not working, and pharmacies are closing. From 2022 to 2023, 37 mass and chain stores closed in this state alone. Below-cost reimbursement, another bill we'll get to this session, and punitive PBM fees, clawbacks, take-it-or-leave-it contracts, and opaque steering and payer practices are the reason stores are closing. And legislation like what is before you today will make a difference. The House is set for a third year to unanimously pass this bill, and we went even further this year, adding a work group that will report out specifically on where PBMs have shifted their profit centers to specialty drugs and to steering. In January this year, the FTC put out one of the most straightforward and damning reports about the egregious PBM practices that I actually submitted to you in your written testimony. The key findings are what we've come to you about and said that they were doing year over year. And I quote from the report. PBMs impose markups of hundreds of thousands of % on numerous specialty generic drugs dispensed at their affiliated pharmacies, including drugs to treat cancer, HIV, and other serious diseases and conditions. Folks in Maryland may have thought that these national trends did not apply here, but we pulled publicly available data, and I would welcome an opportunity to share some specific drug examples with the committee. So I'll go ahead and end there and urge a favorable report. Thank you.
Thank you, Mike. Michael Patty here today on behalf of the independent pharmacies in Maryland in support of Senate Bill 303 with the additional amendment. Just to elaborate on some of the points Senator Lamb made, when we talk about what PBMs currently have to do in the state of Maryland as it relates to premiums, the MIA regulates these premiums. They review them, they post them, they typically give presentations to different committees in both the Senate and the House on those rates. Premiums have not skyrocketed since these PBM laws have been on the books for the individual or small group market. I know there's a lot of testimony in your packet highlighting that concern. That was never realized in the ACA marketplace for what is currently regulated by the MIA. I also wanted to highlight what other states are doing, in particular two states that cannot be more different. Both Florida and New York have taken similar approaches to what this bill hopes to do in regulating their PBM business and their operations in the state. Kaylee talked about pharmacies closing, and I want to go even one step further. Independent pharmacies are just hanging on. They're no longer hiring like they used to. They're not bringing in new pharmacists into their business or letting those pharmacists that are near the end of their career in that retirement type like job continue. That's what the concern is. So when you have a pharmacy owner that had a number of employees down to just themselves, that's a much more challenging business model. The last thing I'll state, just to be brief, healthcare has been shifting towards large multinational corporations. There are very few avenues for a healthcare practitioner to operate a small business, and a local community pharmacy is one of the only opportunities left to be both your own boss and to give back to the community in the healthcare profession. So with that, we ask for a favorable vote on Senate Bill 303.
Senator Kramer.
Thank you, Madam Chair. Good afternoon, Ms. Locklear. Always a pleasure to see you in committee.
Good afternoon, Senator Kramer.
You made some references to drug prices. Would you be kind enough to share with the committee some examples of what it is that you were referencing?
Glad to. So let me start with CMS routinely publishes data on state Medicaid prescription drug expenditures. So that's where this information is coming from. And it's from Q2 of 2024. So as an example, there is a kids' blood cancer drug. I'm not going to try to butcher it, although I'm glad to get that to you, the name of it. But Maryland Managed Care Organization spent $1,400 per prescription. And that might seem reasonable and a reasonable cost for this drug. But the underlying cost of the drug, as measured by the National Average Drug Acquisition Cost, so NADAC, this is something we talk to you about a lot, is just $32 per prescription. And just to make this a little worse, Mark Cuban, I'm going to bring up Mark Cuban here, and his cost plus drug program that he created, where he cuts these middlemen out. is going to sell you this exact drug for $21 plus $5 in shipping. So that means that we are overpaying $1,300 more than the acquisition cost of this drug. And that is what is leading people to struggle to afford their medications. And that's just one example here. There's a medication used to treat prostate cancer, and Maryland MCOs paid $1,600 more than the drug's acquisition cost. There is another drug that's used to treat multiple sclerosis, and MCOs paid $2,100 more than that NADAC acquisition cost. And these examples, I think, really speak to the dysfunctional nature of our drug pricing reimbursement system, and something needs to be done with these PBMs.
Thank you. Thank you, Madam Chair.
Thank you. And Senator Rudy, you have a question?
Yes, thank you, Madam Chair. I'll ask Kaylee, I'll ask you this question too. I'm looking at a report that we got that you submitted in testimony, and I was interested in your answer to Senator Kramer's question about types of drugs and what was going on. But apparently, this is not a report from like a interest group. It's the Federal Trade Commission.
Correct.
It's very extensively cited. Obviously, I didn't have time to read all of the citations just sitting here. But what's the deal with, it looks like the big three PBMs are, their dispensing revenue at their pharmacies is growing. I know we have some protections here in Maryland, but can you just speak to kind of what's going on with specialty drugs and dispensing through
Sure.
PBM
Sure.
affiliated pharmacies?
I would draw your attention to 2 pages here. So on page 2 of the report, there are 6 key findings that I'll go ahead and talk about. And then if you want to see kind of a heat map or infographic, I direct you to page 13. And that shows you the amount of markup that's going on in the commercial and Medicare markets. But if I could, so on page 2 here, there are 6 key findings from that report. First, the big 3 PBMs marked up numerous specialty generic drugs dispensed by their affiliated pharmacies by thousands of %, and many others of hundreds of %. The second, a larger share of commercial prescriptions for the most profitable specialty generic drugs were dispensed by the big 3 PBMs affiliated pharmacies compared with unaffiliated pharmacies. The third, the big 3 PBMs affiliated pharmacies generated over $7.3 billion of dispensing revenue in excess of NADAC on specialty drugs over the study's period. The fourth, in the aggregate, the big 3 PBMs also generated significant income on the specialty generic drugs assessed in this report from what we call spread pricing, i.e. billing their plan sponsor clients more than what they reimburse pharmacies for drugs. 5, the top specialty generic drugs accounted for a significant share of the relevant business segments reported by the big 3 PBMs patient healthcare conglomerates. And finally, plan sponsor expenditures and patient cost sharing on specialty generic drugs increased at a double-digit compound annual growth rates during this study period.
So of those findings, and it's very interesting, but the $7.3 billion in profit
Correct.
above what NADAC recommends for specialty generic drugs, and there's already profit built into the NADAC recommendation, correct? So this is
Correct.
And these are provider plans. All the folks that I hear from folks, whenever we talk about PBMs, I hear from large businesses and groups that have PBM plans. And I understand there's a balance here.
Sure.
But they're literally charging for these specialty drugs, they're charging the plans this.
Correct. Pharmacies are not being reimbursed, and the profits are being kept in their pockets while consumers are the ones left holding the bag and paying absolutely egregious prices for drugs.
Yeah, so when we talk about trying to limit the price of drugs, which we have a lot of debate about in this
We
committee.
do. PDAB will be a conversation,
This
definitely.
this has to be part of that discussion
Absolutely
too.
has to be a part of that
Because it's not helping our
conversation.
ratepayers. Okay.
Correct.
Thank you very much.
Thank you. I have a question. I guess we have a lot of unfavorable, and obviously it's from employees who are part of these ERISA plans. why would someone want to support this kind of overcharging, like $1,400, $1,600, when ultimately it's increasing the cost of their health insurance that they're paying?
So there are states that have taken steps to cut them completely out of the process. And I think Michael can speak to some of this.
Just so we're clear, this bill doesn't suggest cutting PBMs out of the state of Maryland.
Right. But
We could bring a bill like that in, but that's not what this bill does. Other states have taken that approach where only one PBM is allowed to operate in the state or none. It does vary a lot, though.
And so would that be considered in opposition to the ERISA rules to cut out the PBM, or are you allowed to do that? You know, is that acceptable?
I don't have an
You don't
answer
know.
to that.
You
Yeah,
don't know if
I
there's
don't
been
know.
lawsuits or?
Yeah.
Okay, thank you. I see no other questions for this panel. Thank you. We have two unfavorables, Ray Baker and Victoria Leonard. Now, the audience may be wondering why we have so few people on such an important bill, but because this bill was heard last year, there's a 2-and-2 rule. So we have the sponsor plus 2 opponents and 2 proponents. So these two, Ray Baker and Victoria Leonard, are chosen to be our 2 unfavorables.
Good afternoon, Chair, committee members. My name is Ray Baker. I'm the Maryland Director of the Baltimore, D.C. Building Trades Council, and we urge an unfavorable report on SB 303. You have my written testimony in front of you. Chair Beidel alluded to some of the opposition that is already present, and I echo what Chair Beidel offered. In the interest of time, I want to highlight 4 specific points for us to consider. We are concerned about the possibilities and the potential in this legislation. With respect to what we heard just now, we are concerned about the potential of increasing prescription dispensing fees. That is something that we are worried about that will be negatively impactful for our members and our unions. We're also concerned about the altering terms and costs of mail order pharmacy dispensing. Namely, that's important for a number of our retirees. Third, we are concerned about altering current networks. There are so many of our members who are enjoying or appreciate the benefits plan as they have it, and we are concerned about the potential in this bill that will alter that in ways that would adversely affect them. Finally, and fourth, eliminating protections from price gouging for specialty drugs. We previously heard conversation around specialty drugs, and the capacity and/or opportunity for price gouging there seems far too probable with this particular piece of legislation. So in that vein, we urge an unfavorable report on this bill. Thank you.
Good afternoon, Chair Beidel, Vice Chair Hayes, and members of the committee. Thank you for the opportunity to offer testimony on this bill, and I'm here testifying on behalf of my union, and that's Laborers Local 11, which is an affiliate of the Laborers International Union of North America, or LIUNA for short. And we have more than 3,000 members who live across suburban Maryland, Northern Virginia, and the District of Columbia. We are helping build all the infrastructure projects in this area, including we will be working on the Key Bridge. And more than half of our members are Maryland residents. And I guess what I want to focus on in my statement is that this legislation would create inconsistent rules across state lines that will increase co-pays and decrease union member benefits. And an example of that for Laborers Local 11, we do have, as I said, our jurisdiction includes Northern Virginia, Maryland, and the district. And so our plan covers those 3 areas. And so this would make it very difficult for our plan since it does cross state lines. So we would urge an unfavorable report on this bill.
Thank you. I want to ask Mr. Baker a question. You kind of went opposite of what I was trying to get to. If a PBM is charging, say, $1,400 for a oncology drug that Mark Cuban charges $21 for, why would you be supporting a PBM on your program?
The potential of the bill to complicate and challenge some of the existing plans and payments that our members are already accustomed to is what our concern is. The specific anecdote or example of Mr. Cuban and his bill and the price of his particular drug seems advantageous, and I'm not in a position to rebut that specific example. But the capacity in the bill at large to complicate and challenge a number of other drugs that would adversely affect our membership is what draws our concern.
Thank you for that. Do I have any other questions from the committee? I see no other questions. Thank you for your testimony.
Thank you.
That ends the bill hearing on Senate Bill 303. A little confusing here. Our next bill is Senate Bill 3. Senator Ellis. And your panel, we have Jonathan Bolden, that'll be virtual, Giannis Bonilla, Julius Wright, and Roger Mano, if you want to bring your panel up. Okay. Okay. Who did you tell that? Okay. Senator Ellis, your virtual witness is in the meeting. I mean,
Okay.
He's virtual, so.
Wonderful.
We're set. Thank you.
Thank you, Madam Chair. So, good afternoon, Chair Bidle, Vice Chair Hayes, a member of the Finance Committee. I'm Senator Arthur Ellis from Charles County, here to present Senate Bill 0003. It has this low number because we worked on it for a long time in the interim, and we pre-filed this bill, and it's a result of a lot of work, a lot of consultation. So, a lot of thought. So I want to thank you for being here to hear this bill, which requires the Commissioner of Labor and Industry to develop a data dashboard, which includes important data like contractor wages and apprenticeship data to improve access to the procurement and apprenticeship process. While the Maryland Marketplace Advantage, EMA, provides public access to procurement information, Maryland constituents have expressed concern that additional transparency and information are needed. This bill will allow procurement information to be displayed in a human-centered, user-friendly way that is updated once a month to address these concerns. In a time when our country is inundated with federal attacks on issues with diversity, equity, and inclusion, Maryland can show residents that we are still committed to justice and diversity. This bill will improve transparency for both constituents and employees so that we can ensure our procurement and apprenticeship process is efficient and accessible to all of the diverse talent that Maryland has to offer. This legislation has several key benefits. One, increased revenues. By ensuring workers are paid fair wages, the legislation supports higher income tax revenues and consumer spending. Workers with better wages contribute more to the local economy, and tax collections from both individuals and businesses go up. Job creation. When prevailing wages are enforced, local contractors are more competitive, leading to job growth in the construction industry. Higher wages can reduce turnover and ensure stable employment, which supports long-term job creation. Additionally, our third point, workforce development opportunities. This legislation encourages contractors to invest in apprenticeships and training programs to meet prevailing wage standards. This investment in skill development creates a more qualified workforce and ensures workers have pathways to long-term career growth. This bill also will spur local hiring. By promoting fair wages, local contractors and workers are more likely to be employed on projects, fostering community-based hiring. This leads to greater economic benefits within the community and reduced reliance on out-of-state labor. I must also include out-of-country labor. Quality of workmanship. Prevailing wage standards attract more skilled and experienced workers, improving the overall quality of the work. Projects are more likely to be completed on time within budget and with fewer costly repairs or deficiencies, leading to a long-term cost savings for public projects. I want to add a little flavor to this hearing, looking at the fiscal and policy note, where the Department of Labor, which is required by this bill, to develop a clear and easy to understand graphical data dashboard to include specific information about workers and wages for ongoing public work contractors. Where contractors must submit specified information to the commissioner once a week, and the commissioner must update the data dashboard at least once a month. And the dashboard must be displayed prominently on the Maryland Labor website. And the commissioner, of course, may adopt regulations to make it happen. In analyzing this bill, the Department of Labor came back and says a reliable estimate on the cost of developing a functional system is not feasible in time, but this may cost millions and millions of dollars. You know, I mean, what kind of fiscal note is that? I mean, come on now, it's a slap in the face. This is a serious issue. I know myself and the advocates worked months and months on this bill. I mean, why wouldn't they just respect this process enough to say, hey, y'all, let's give a serious estimate on the cost. You know, IT is not a new industry. You know, it's been around a long time. I started my career in the U.S. Air Force working in IT, and that was like in 1983. Yeah, a little while ago. And so it's not a new industry. It's not a mystery industry. They can't estimate the cost of a computer system. And this bill calls for collection of information. Information like the number of employees employed. Oh, how hard is that? The wages and overtime wages paid. How difficult is that? Fringe benefits, job classification of each employee. I mean, just regular data on employees. I mean, anyone can take that and put it in a spreadsheet, right? And submit it and make it accessible for inspection. Why would it cost untold millions to do this? Oh my Lord, we're going to bankrupt the state. I mean, it's ridiculous. You know, it's an insult to get a fiscal note of this magnitude. That means they're not taking this serious. But I tell you, the working men and women are taking this bill serious because they're not getting paid prevailing wages. They're not being compensated properly. They're not making the kind of money that they need to make because we, the state, are not holding these bad actors responsible and accountable. And whoever wrote this fiscal note, I don't really need to know their names, but you know, they need to really take us in the Maryland General Assembly seriously. I just want to add that several other states are doing this data dashboard. New Jersey, Washington. How can they do it when we can't? Come on now. So I will end there and ask for a favorable report, Committee on Senate Bill 3.
Thank you, Senator Ellis. Can we go to your virtual person, Jonathan Bolden? Is he? He's in there. Okay. Let's see. Okay, I'll go to somebody else.
No, I'm actually right
there
here.
he is.
Greetings. How you doing?
Good. How are you?
Good. So I'm Jonathan Bolden. I'm the president of RSC Electrical and Mechanical. I am a union company. I'm based in Prince George's County. I'm certified as an MBE. I wanted to speak on this bill today for a few reasons. One, I'm in total support of this bill. We as contractors, we have a lot we have to deal with, especially with non-union contractors, and not just to slam non-union contractors, just contractors that will shortchange items in our state, in our county, because we're here, a lot of contractors come out of town and they try and shortchange us and then go back to their location. This bill will support us because we're able to create a database and we know where the funding is coming from, who's being paid, and making sure these wages are correct. So I'm in total support of this bill. Thank you.
Thank you for your testimony. We're going to go to Giannis Bonilla. Thank you.
Hello, my name is Jonas Bonilla. I'm an organizer with the Mid-Atlantic Pipe Trades. And let me start off with saying, dear Chairs Wilson, and Beldy, and members of the House of the Economic.
That's okay, you're just sharing your testimony, it's fine.
Yes. Once again, I'm an organizer with the Mid-Atlantic Pipe Trades, and I just wanted to share my testimony about what I go through on my day-to-day. As an organizer, I walk from job site to job site, and I go on these construction sites talking with workers, talking to them about their rights, union representation, and discussing industry standards. When I have these conversations, it often reveals troubling realities. Workers who are not being paid what they are owed, who have been misclassified by their employers, who are not being paid, who are facing other labor violations. When workers tell me they aren't receiving their proper wages under Maryland prevailing wage laws, I help them navigate the process of filing complaints with the Maryland Department of Labor, and DC Attorney General, and the Maryland Attorney Generals. And a lot of these cases are about misclassification, licensing violations, and overtime abuse. I help them by connecting them with legal counsel and to pursue their rights. Wage theft and worker misclassification are not abstract problems, they are realities I encounter every day. Contractors who misclassify workers as independent contractors to do so to avoid paying taxes, workers' compensation, and overtime, shifting the burden onto workers and law-abiding businesses. Without proper oversight, these practices persist, undercutting honest contractors and denying workers and wages and protections they are due. Workers frequently report that they are not receiving the required prevailing wage and are being paid under the table or are forced to work overtime without proper compensation. Without a transparent payroll records database, these violations remain hidden and enforcement is inconsistent at best. The creation of certified apprenticeship and prevailing wage database is essential. Similar measures in New York have resulted in a 21% increase in recovered lost wages and a significant reduction in worker misclassification violations. Nevada's apprenticeship tracking system has led to a 12% increase in program completion rates and better compliance from apprenticeship sponsors. Maryland stands to benefit in the same way, ensuring fair compensation, workforce accountability, and economic integrity. This is, I'm going to go off script here, just going off of what I go every day. And it's tough when you go on these job sites and you talk to workers and they tell me, well, I haven't gotten paid. And they are asking me, somebody who's outside the job site, saying, am I being paid the correct wages? This database is essential so that it can, workers can't go wondering if the job site they're on is a prevailing wage job site. Asking me if they're getting paid the correct wages when this is all projects that are publicly being funded is not fair to them, it's not fair to the taxpayers, it's not fair to me.
Thank you for your testimony. Julius Wright?
Dear Senator Bidle, and members of this Senate Finance Committee, thank you for the opportunity to provide my testimony in support of the Maryland Apprenticeship and Prevailing Wage Transparency Act. My name is Julius Wright, and I represent UA Plumbers and Gas Fitters Local 5, which has trained and employed skilled tradesmen in the Washington, D.C. area since 1890. With over 1,800 highly trained professionals, including 300 apprentices, Local 5 upholds industry excellence and safety. This legislation strengthens Maryland's labor standards, ensures responsible use of taxpayer dollars, and combats wage theft and worker misclassification. By establishing databases to monitor prevailing wage compliance and apprenticeship program, Maryland follows successful models from states like Nevada and New York. A state transparency and prevailing wage and compliance, as seen in New York City, reduces fraud and ensures fair competition among contractors. A statewide apprenticeship database will enhance accountability, tracking program success, and strengthening workforce development. Nevada has shown that such oversight increases program completion rates and economic growth. The Maryland State Apprenticeship and Prevailing Wage Transparency Act is a smart investment that strengthens our workforce, protects taxpayers, and ensures fair labor practices. I urge your support to improve oversight, workforce development, and economic integrity. Thank you.
Thank you. And Roger?
Well, thank you, Madam Chair, Mr. Vice Chair, members of the committee, Roger Mano, attorney Mano and Associates, on behalf of the Mid-Atlantic Pipe Trades Association, that is the UA unions in the tri-state, and their signatory contractors represented by the Mechanical Contractors Association of Metro Washington. I'll echo the comments that were made previously. You have my written testimony. I just wanted to circle back to what Mr. Bolden from RSC Mechanical mentioned a few minutes ago, and that is that this is a bill that will help small businesses by providing some sunshine and some public knowledge of what's going on work sites across the state. It'll help small businesses to better, first of all, their situational awareness of what's going on around them with their competitors, and to give them a better sense of how to go about building their own workforces. This database that we are talking about in this bill is a combination of two databases, one in New York, which is a prevailing wage payroll database. The Nevada database is an apprenticeship database. Those databases actually have paid for themselves, speaking to the fiscal note here. In the case of New York, that database has returned about 18% fewer prevailing wage violations across the state since its inception, and the Nevada database has resulted in about 12% increased apprenticeship graduation rates, which are super important in terms of building the next generation of highly skilled workers. Now I'll speak directly to the fiscal note, which is I understand the challenge that presents to this committee. I would ask, while you're considering this bill, to give us some patience and forbearance as we study this issue, to be able to come up with alternative financing in order to get this database built, whether that is to bring in PhD students into IT professionals to be able to code such a database, or to speak to other states, such as, I'm thinking of New Jersey, Governor Murphy's database, which is outstanding. Perhaps enter into some kind of a licensing arrangement with another state that has this database, so we can bring that to you. But over the interim, for sure, we should be able to provide some alternative financing. So thank you so much.
Senator Washington?
Thank you. Thank you. Who would manage the database? Who's responsible for managing it?
Department of Labor.
Department of Labor. Okay. And is it true that it says it's a weekly reporting from
the contractors? Yes.
Correct.
Into the Department of Labor agency that keeps track, and they will compile it and issue a report once a month. And
I'm thinking about contractors and all the work they have to do on their jobs that they currently have. Is weekly a little bit overburdensome for contractors to complete their work on time, complete their job site on time? Is that too burdensome for some of the contractors? And is there a cutoff on? I'll have another question after you answer this one. And anyone can answer.
Yeah.
I would just refer you to the other states, Senator. It hasn't been a problem in other states.
Weekly?
I think I'll leave that up to the committee, obviously. I think certainly monthly, that information would be valuable to the contractors that are in competition, and to the public that is tracking these things in terms of providing some oversight of public funds.
The bill says weekly, right? Is that right?
Yes, it does.
Right, okay. And if it is weekly, are we talking about, is there a threshold for the contract, the amount of the contract to be reported on? Is it $20,000? Is it 50? Is it $1 million? Is it 3 million?
Well, in the bill, there's not a requirement for dollar amount. But if they have a public work contract, then they're required to submit this report. So the bill as written doesn't have a limit as far as dollar amount. And could I just also add to something that Mr. Manuel said, that in the fiscal note, it talks about other states. This dashboard was developed using nonprofit funds and funds from others also. So that's not a novel idea. So the industry have financed this dashboard development in other states. I just wanted to kind of add that.
Right. Is there a threshold in other states that you know of? No?
I don't know of a threshold. No.
All right, thank you.
Thank you, Senator. Any other questions for this panel? Thank you all very much.
Thank you.
Thank you.
Now we have Ray Baker and Donna Edwards. Favorable. I don't see Donna. She must be in another committee. Mr. Baker, go ahead.
Good afternoon again. For the record, my name is Ray Baker, Maryland Director of the Baltimore, D.C. Building Trades, and I'm testifying in asking for a favorable report on this piece of legislation. You have my written testimony, so I will not belabor the point. Much of the points that I wish to offer are consistent with what we've heard from our previous panel in support of ensuring that our workers are being paid prevailing wage, and specifically, I'd like to draw the committee's attention to the need to remedy the issue of wage theft. Maryland, unfortunately, is among the leaders in the nation at wage theft, and at a time when we're all very sensitive to ways that we can help contribute to our state's economy in a positive form and fashion, ensuring that our workers are paid what they deserve, ensuring that taxes are collected as they should be, is an effective measure to that. I echo Mr. Mano's suggestion around considering studies for alternate ways of finding funding or capacity for technology to help stand up this database. I am interested in and already engaged in working with our Department of Labor, specifically our Office of Apprenticeships, in finding ways that would do that, that could mitigate, as Senator Ellis told us, that comically laughable fiscal note that we heard. And so I would encourage a favorable report that would at least allow us the time to create some creative developments and ways that we could pay for this to ensure that everyone's needs would be met, our workers, most importantly, our state finances, and even the needs of our contractors. Thank you for your time.
Mr. Baker, we had a briefing just a few weeks ago about the Department of Labor and the investigations that they're doing to try to find wage theft. And they reported 29 violations. I asked them to work a little harder on those investigations because we hear about the wage theft frequently. So thank you for your testimony.
Thank you, Chair. We also asked them to work a little harder. We look forward to the Attorney General's bill that we think will address that ultimately. And so I'm happy to work with any of you all offline to continue to develop this, to attack that issue in particular, and even find ways to get through this bill.
Thank you for your
Thank you so
testimony.
much.
And finally, we have Marcus Jackson, favorable with amendment.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Marcus Jackson, Director of Government Affairs for the Associated Builders and Contractors of Maryland. I'm here to opine on Senate Bill 3. I'm going to be brief with my remarks. We do agree with that a database, a data dashboard can be a valuable tool for oversight and accountability. However, we have concerns about the reporting frequency mandated in Section 17206B. Requiring contractors to submit certain information weekly creates an unnecessary and duplicative reporting burden, and this information includes detailed wage and benefit data. It's already provided to the state through certified payroll. With that said, and with that in mind, we may recommend the following amendment. On page 3 to strike of the bill, strike line 1 to 3 of Section 17-206. We believe that this approach will achieve the bill's transparency goals without creating duplicate reporting requirements. On behalf of our members at ABC of Maryland, we respectfully request a favorable with amendment report on SB 3.
Thank you, Mr. Jackson. Nice to see you again.
Good to see you as well.
I don't see any questions from, oh, I do, Senator Ellis.
Yeah, thank you, Madam Chair. Thank you, Mr. Jackson, for your testimony. So I just want to kind of be clear about the issues you were concerned about. It's hard to listen and flip through the lines as you spoke. So since you're here, so you think the weekly reporting is not good. So is there recommended in your amendments?
Well, I'm not going to say
Or is it monthly you recommend, or?
Yeah, I think that to Senator Washington's point earlier, that if you're a smaller business, to have that type of requirement can be a bit burdensome. And we do appreciate the concept of a data dashboard. It's just that we feel that if the information is already being provided to the state, that maybe the state can provide that information to your dashboard that you're recommending. But that our members, and some of those members are smaller businesses, might not have the capacity to be able to do that type of weekly reporting.
Okay, but you can't give me like
I would take
bi-weekly or monthly.
I mean, monthly is fine. I mean, I think that's appropriate.
Okay.
So.
Yeah. Okay.
But we support the concept of the database.
And could you reach out to me offline and
Absolutely.
we'll talk about the amendments and how we can work and get this done?
Yes, sir.
Okay, great. Thank you. Thank you, Madam Chair.
Thank you. Senator Washington?
Yeah, is there, for most contracts with the state, is there a typical period where you have to do reporting to the state? Is it only when you submit for reimbursement, or is there a typical time?
Typically, it's once a month.
Typically once a month.
You know, some companies, I believe, report biweekly, but from my understanding, it's once a month.
Okay, thank you.
Thank you, Senator. All right, now I see no other questions. That ends the hearing on Senate Bill 3, and my vice chair is going to take over.
Thank you, Madam Chair. Next, we're going to hear Senate Bill 734. Madam Chair, do you want your panel to join you?
Please.
All right, Jeffrey Buttle, William False, and Jamie McIntosh. Please come up to the table. That's it, 734. All right, Senate Bill 374. Gotcha, sorry. That's my dyslexia.
I pressed it. Maybe you're going to smack me. Good afternoon, committee, and my Vice Chair, Senator Hayes. Thank you for hearing Senate Bill 374. Before I go into the bill, I want to take a moment and tell you a little bit about our good friend, a lot of us knew, Delegate Jimmy Malone. And so Jimmy was a lifelong, ever since he was an adult or even a teenager, firefighter, volunteer firefighter, and paid firefighter. Just a few years ago, Jimmy was diagnosed with leukemia, and it fortunately was cleared up. His son donated bone marrow, and he was feeling better when he was diagnosed with a brain tumor. And so this is what our firefighters deal with. They are exposed to so many chemicals and just, you know, environmental things that will affect their longevity, their mortality. But I want to take a minute and introduce some people that are here today to support the bill. They're not going to speak, but I want to introduce them. So Jimmy, Delegate Malone's wife, Darlene, is here with us. A lot of you know Darlene. His daughter, Danica, is with us. And our longtime friend and chair, Maggie McIntosh, is here, good friend of Jimmy. So they're here to listen to the hearing today. Thank you. So a lot of us worked with Jimmy in the House. He was my vice chair for 8 years and was a very good friend. So, but thank you for the opportunity to present Senate Bill 374, Health Insurance Cancer Screenings for Professional Firefighters. This will require that there's a list of cancer screenings that the International Association of Firefighters recommend. And if you look in our workman's comp law at the presumptions that we've already given our firefighters, we already spell out that there are so many cancers that they're exposed to in the presumptions. But this bill would require even additional screenings from what they're already getting because of the statistics that are being kept about what our firefighters are exposed to. They're exposed to many known and unknown chemicals and carcinogens in their line of work, and it's been proven that firefighters are at a risk for cancer and other illnesses at a greater rate than the general population. In 2022, the International Agency for Research on Cancer, IARC, reclassified firefighting as carcinogenic to humans which is IARC's highest carcinogen hazard classification. So it's become such a personal issue for me, and I actually was working on the bill before Jimmy passed away, but it's just a very personal issue. I've known so many firefighters that have passed away from cancer, and I think we need to do a better job of protecting them and providing care. And, you know, people are going to talk about the cost and who's going to pay for it, but isn't it better to diagnose someone in an early stage, maybe stage 1, and not wait till stage 4? Don't you think we'll spend less money if we know early on that there's cancer versus when it's become life-threatening? So I'll ask for your support on Senate Bill 374 and turn this over to my panel, starting with Mr. Buttle.
All right. Good afternoon, Mr. Vice Chair. Jeff Buttle, President of the Professional Firefighters of Maryland. We represent approximately 10,000 active and retired fire and EMS personnel across the state of Maryland. I'd like to start with just a few words about Jimmy Malone, who was a close personal friend and colleague who is missed dearly and remembered fondly by all of his fire service colleagues. Jimmy was a champion for the fire service, in which he cared very deeply about his brother and sister firefighters and EMS personnel. He served many years as a delegate in the halls of the Maryland General Assembly, an institution he really loved being a part of. Sadly, Jimmy Malone passed away of cancer in December of this past year. I can't help to think that maybe if we had this type of program in place when Jimmy started in the fire service, maybe, just maybe, we could have identified the cancer sooner and treated it in the earlier stages. Firefighters work in a high-risk profession. We accept those risks every time we go out the door of the fire station on an emergency response. However, the single greatest risk we face as firefighters is occupational cancer. It is literally killing our firefighters. This legislation will provide meaningful access to early cancer screening when cancer is highly treatable and the chance of success in sending it into remission is at its greatest. Legislators always ask, how can we help the firefighters? Pass this bill. Because if you do, it will provide an impact for generations of firefighters to come. It is also fitting that having this bill named after my friend and colleague Jimmy Malone will in many ways allow him to continue to look over his brother and sister firefighters, just as he always did and just as he always will continue to do in spirit. Thank you, Mr. Vice Chair.
Good afternoon, Vice Chairman Hayes, Chairperson Hayes, and committee members. My name is Bill Faust. I'm the second Vice President of the Maryland State Firefighters Association, representing more than 30,000 volunteer fire, rescue, and EMS personnel. I'm here in favor of Senate Bill 374, Cancer Screening for Professional Firefighters, the James Jimmy Malone Act. James Jimmy Malone was a retired career firefighter with Baltimore County, a volunteer firefighter, and 20 years with the House of Delegates. With this bill, he could have had an earlier diagnosis of cancer and could possibly still be with us. We are losing firefighters from cancer at an alarming rate, and we need to do everything we can to save our people. So please help us protect the very people that protect the citizens of this great state. Thank you for your time. If you have any questions, I'll be more than happy to answer. Thank you.
Good afternoon, Chairwoman Beidel, Vice Chair Hayes, and the rest of the Finance Committee. For the record, my name is Jamie McIntosh, and I'm here representing myself and over 900 members of the Anne Arundel County Professional Firefighters. I'm speaking in support of Senate Bill 374. I'm a professional firefighter who has cancer. When I began my career, nobody was talking about the increased risk of cancer to firefighters. That was 32 years ago. In 2017, although it wasn't guaranteed at the time, I was lucky enough to be able to have some early testing done, which found anomalies in my blood values. Several months of further testing were ultimately determined to be caused by hairy cell leukemia. Early screening not only allowed me to receive treatment earlier in the progression of my disease, but also protected me while I was working before my treatment began. It's difficult for me to think about what might have happened if my cancer had not been discovered early. My white blood count was low. My absolute neutrophil count was low. That's the ANC. My platelet level was low. Low white blood counts and low absolute neutrophil counts cause a decreased immune response when exposed to disease. As a professional firefighter, I'm constantly exposed to diseases on emergency medical responses. If I had not known about my decreased blood counts, I could have easily contracted normally benign disease that would have caused serious illness or even death. Platelets are the substances in blood that promote clotting. With a decreased platelet level, I was at risk for significant bleeding from a small cut. It would have been even worse if I had had another serious injury at work, which required emergency surgery. Early screening provided me the best opportunity to remain healthy and continue my career serving the citizens of Anne Arundel County as a professional firefighter. Unfortunately, many cancers do not have early markers in blood tests. Some require ultrasound and other types of scans. Every method of early screening should be available to firefighters in order to give them the best chance to discover and treat cancer at its early stages. This is not only the right thing to do because firefighters are at higher risk of cancer, but it's also the financially responsible thing to do. Early detection often means less invasive and less costly treatments are available. Early screening saves lives, careers, and money. For these reasons, I respectfully urge the committee to issue a favorable report for Senate Bill 374.
Thank you so much, Madam Chair, for bringing this bill before us. I didn't get a chance to serve with Jimmy Malone, but had a chance to admire him from afar as a staffer here in the legislature. Thank you so much, Jeffrey, William, and Jamie, for sharing your stories and your service to us here in the state of Maryland. And thank you to the Malone family for being with us this afternoon. We greatly appreciate it. And to our former colleague, delegate, and Chairwoman McIntosh, it's always a pleasure to have you with us. Colleagues, are there any questions for this panel? Senator Kramer.
Thank you, Mr. Chair, and I will preface my comments, and I had the honor of speaking with Jimmy's wife and daughter before the committee hearing. I was a big Jimmy Malone fan, loved him to death. And being one who enjoys mischief, he and I had a lot of fun together. And he was the perfect partner to get into trouble with. And but he was also a dedicated and very serious lawmaker. And I think that everyone who had the opportunity to know State Delegate Malone and Vice Chair Malone has nothing but exceptional memories of what a great human being Jimmy was. I think it's fascinating. Typically, we, on bills like this, have MACO come up after the bill and tell us how burdensome it's going to be, but Madam Chair, I will note that in the fiscal and policy note, and I do agree with my good colleague from Charles that very often the dollar figures in these fiscal and policy notes seem a little bit skewed. But I will note, Madam Chair, that it reads, the Maryland Association of Counties advises that the bill has a minimal impact on most jurisdictions that employ professional firefighters. Madam Chair, thank you for this very important legislation. It is guaranteed to save lives, no doubt. And I look forward to joining along with my committee colleagues in voting in favor of this very important legislation. Thank you, Mr. Chair.
Thank you, Senator Kramer. Senator Ellis.
Yeah. Thank you, Mr. Vice Chair. And thank you, Senator, for this very important bill. For firefighters, you know, my deepest sympathies. I didn't know the delegate. I got here after. But, you know, thank you and family for your service. And for the firefighters in Maryland and throughout the country, you know, when we call, you answer. You're there to save lives in very dangerous situations. I always definitely appreciate that. I want to piggyback on Senator Kramer's point about MACO. Going through their letters of favorable amendment, they recommend, but before I ask that, let me ask, your health care policies, does the state or the counties pay for that, those policies?
I think it depends on the jurisdiction. Some of the larger counties are self-insured, and some of the smaller ones have more fully insured products from companies. So it just depends.
But the county are the ones who manage the health policies.
That's
counties.
correct. Yeah.
And it goes through whether it's self-funded or whether they have insurance companies, but those policies come through the county and the county budgets, right?
Correct.
Yeah.
And Baltimore City.
And Baltimore City.
Not considered a county, but Baltimore City.
Baltimore City budget. Okay, so thank you for that fact. So get to the question with MACO's letter of favorable amendment. It said, to that end, MACO suggests an amendment direct to the state funding to support this mandates of this bill. So that's in their letter. They want the state to come in and pay for whatever is required in this legislation. Isn't that kind of odd, since your insurances come through the counties that employ firefighters?
Yeah, I'm not sure I understand MACO's position on that. Hopefully they can be able to explain it if they're testifying in person today, which I think they are. I think to the chair's point, when she introduced the bill, particularly for the self-insured counties, the idea is to identify and treat the cancer in the early stages, which is much more cost-effective than allowing it to go to the point where you're experiencing signs and symptoms. Usually that means you're stage 3, stage 4, and that gets into really expensive treatment, and oftentimes it's just not as effective when you allow the cancer to progress. So the idea is to treat it earlier, not only for the benefit of the firefighter, but when the costs are much less than allowing it to progress into further stages which require more advanced treatment that's more costly.
Yeah, and thank you for that. I'm just kind of concerned about quibbling over who's going to pay. I mean, our firefighters, brave men and women, are servicing the communities employed by that jurisdiction, the city or the county. So why would they want to quibble? But I'll kind of work on that. Maybe ask someone else later about that point. So thank you for your answer. Appreciate that.
Thank you, Senator.
Thank you, Senator Ellis. Senator Mounts?
Thank you, Mr. Vice Chair. I didn't have the honor to serve with Delegate Malone, and this is a great bill, and he was well known, on the Eastern Shore with the leadership with a lot of our firefighting emergency responders. Most of our folks on the shore are volunteers, and I believe this legislation does not address the volunteers; it just addresses professionals, and we'll get there at some point. And this is a great way to lead to that direction. But I can just tell you, I've been to too many funerals for firefighters who died of cancer, and they don't know how they got it, but everybody kind of knows how they got it. And so it's an incredible tribute to Delegate Malone, and look forward to keeping those volunteer firefighters in everybody's mind. So thank you.
Thank you, Senator.
Isn't that so?
That's so. That's so.
Thank you, Senator Miles. Are there any additional questions? Senator Lamb.
And thank you to the chair to bring this forward. This is a really important issue, particularly from a medical standpoint. I have the privilege of serving as the medical director of occupational health at one of our Hopkins facilities where we actually have a fire station. And so I do annual physicals of our firefighters every year. And as part of that, recognize that the opportunities that are presented here as part of this bill are really, really important from a prevention standpoint when you look at cancer screening. And so just wanted to thank you for bringing this forward. As someone who, while I was in the House, Delegate Malone was my predecessor in District 12, where we had an overlap in Southwest Baltimore County, and still remember his really infectious laugh and just wonderful, larger-than-life personality that I think all of us, hold dear and remember, and certainly remember that motto that we cherish in Southwest Baltimore County, that you're never alone with Jimmy Malone, and this is a great way to continue his legacy. So thank you so much, isn't that so?
Thank you, Senator. Maybe you can give me a little help with Senator Ellis to figure out how we're going to pay for this, but I think we have to find a way. So thank you for that.
Are there any additional questions of this panel? Thank you all so very much for your testimony this afternoon. We do have someone to sign up favorable with amendments. Carrington Anderson, will you please come to the table?
Which one?
Not you.
What was that, Senator? Oh. Always appreciate your feedback, Senator Kramer. Thank you, Mr. Vice Chair, members of the committee. Carrington Anderson with the Maryland Association of Counties, speaking in support with amendments on Senate Bill 374. First, I'd like to thank the chair for bringing this bill. MACO fully agrees with the intent of this legislation and the important work it will do for our career firefighters. Our only issue, as you're well aware, is the fiscal impact of this bill. I want to share that every county who has a paid firefighter has an existing cancer screening program. They all look a little bit different depending on the county. Again, some use a grant program to pay for this. This bill would require no cost sharing, and we get that. Agree with the idea of that. I think it's a great idea, but some of the counties that we've been speaking to estimate a $1 million fiscal impact on this bill. And if it is a priority of the state, which is entirely within your guys' authority to say so, that we would suggest that the state set aside money to make this a funded mandate. Counties cannot absorb this cost. We're trying to pay for the blueprint, and additionally want to point out that 2/3 of Marylanders live in a county where that county already imposes the maximum income tax rate. I understand that the state is in a difficult budget situation, and counties are as well. I also just want to make a note that Senator Gazone has a bill, it's Senate Bill 849, that is increasing the funding for the professional and volunteer firefighter cancer screening technology program. I also think that's another great approach that MACO is going to be supporting. Again, very supportive of this bill and just want to work out that funding pieces. And again, really just appreciate the chair bringing this bill and the previous testimony. Respect you all very much. And it's for these reasons that MACO would request a favorable with amendment report on Senate Bill 374. Thank you.
Thank you so much for your testimony. Are there any questions? Senator Kramer.
And thank you for that, Mr. Chair. So Carrington, I am confused.
Yes.
Not that that's unique. However, under the fiscal and policy note, the definition under local expenditures offers the following. The Maryland Association of Counties advises that the bill has a minimal impact on most jurisdictions that employ professional firefighters. Where is that? Please jump on in.
Thank you, Senator Kramer, for the question. And I do think it is important to address that. I think that was a little wishful thinking on our part, hoping to be able to completely support this bill. And we get a lot of fiscal notes, and there's a quick turnaround and deadline, and we're trying to get feedback from counties while also trying to fill out these fiscal notes to not delay DLS. And so we talked within our team, and it looked like maybe this would be a minimal impact. And then after submitting that after submitting that fiscal note information request, we received feedback from multiple counties that actually this will have a fiscal impact on them. In the fiscal note, I think Howard County, they share theirs, but we also heard from multiple other counties on the fiscal impact.
All right, well, I appreciate that. I would say MACO should have stuck with their initial inclination on this and come to the table and look like geniuses. But having said that, I will state that this clearly is a meritorious investment regardless of the fiscal note to any jurisdiction or the state for that matter, that if we have the opportunity and the technology, the medical know-how to save the lives of these courageous women and men who are doing this high-risk profession that saves so many of those of us out there in the public, that this is an absolute worthwhile investment. And I will, reiterate the chair's point. The cost savings and the fiscal notes generally don't reflect the savings at the other end by not only catching this early when the costs are significantly less, but also the grief that comes with the loss of a loved one who could have been diagnosed with the cancer but was not. So Carrington, thank you. I appreciate your clearing up that confusion for me, and always pleasure to see you.
Thank you, Senator Kramer, and appreciate what you said and agree with, again, the intent with this bill. And the counties that do have career firefighters, they all have an existing cancer screening program.
Thank you. Thank you, Mr. Chair.
Thank you, Senator Kramer, and thank you for your testimony. Are there any additional questions of this panelist? Seeing none, thank you so very much. This ends the hearing on Senate Bill 374. Next, we will hear Senate Bill 372. Guess who? Madam Chair, Senator Beidel. She will be joined at the podium by Jake Whitaker, Dr. Helen Hughes, and Dr. Anthony Roggio, R-O-G-G-I-O. Madam Chair, did you decide not to go with your pen? Oh, you want to go? Yeah. No problem. Please.
Thank you.
Thank you. You may be
I wasn't
proceed when
listening.
ready.
Did you call up my panel, Mr. Vice Chair? Thank you. So Senate Bill 372 is preserving telehealth access, and it really is just a continuation of what we've been doing with telehealth. Basically eliminates the sunset and allows us to go forward with particularly audio-only telehealth, which has really been helpful for elderly people and people that have transportation issues. I can tell you, my dad that just passed away, almost 97, there were multiple times we were able to use telehealth with him. If my sister and I were there, we could use an iPad, but if we weren't there, he could only handle a telephone. A lot of people can handle, the visible part, they can handle the audio. So the bill just asks us to continue to cover telehealth with audio only, and I hope you can support the continuation of this process, and turn it over to my panel.
Thank you, Madam Chair. Jake?
Great. Thank you, Mr. Vice Chair, members of the committee. I'm Jake Whitaker on behalf of the Maryland Hospital Association, here to testify in strong support of Senate Bill 372. Since 2020, MHA has partnered with lawmakers to remove barriers to telehealth services because we know that it's critical to ensuring that people have access to care. We also know that increased access to audio-only telehealth services promote health equity and access to folks living in rural areas and underserved areas who may not have access to rural broadband. For people without access to these audio-only technologies, picking up the phone and calling their provider may be the only way to get access to care without waiting for a long time for an in-person appointment or driving long distances. Preserving the use of the telehealth services is also critical to the ongoing national healthcare staffing crisis. For example, it helps stretch the state's behavioral healthcare workforce, their capabilities, and improves efficiency so more people can access those critical behavioral health services. And so as a result, and we now know after several years of doing this, that expanded access to telehealth services in recent years has provided Marylanders with additional opportunities to get primary care and behavioral health services in their communities. And we know that when patients have access to primary care and behavioral health care in the community, they're less likely to use emergency department services and contribute to those emergency department wait times. And finally, I'll just conclude by saying that about 45 states and DC now allow audio-only telehealth. And I think that's because we've seen firsthand that telehealth broadens access to care, it improves patient outcomes and satisfaction, and helps address health equities. So I'd just really like to thank Chair Beidel for her leadership and support on this legislation, and we respectfully request a favorable report on Senate Bill 372. Thanks.
Hughes?
Good afternoon, Vice Chair and members of the committee. Thanks to the chair for introducing this. My name is Helen Hughes, and I'm here on behalf of Johns Hopkins in strong support of Senate Bill 372. I am the medical director of telemedicine at Johns Hopkins. I'm also a practicing pediatrician. You have my written testimony, but I wanted to highlight 2 points. One is just the really broad scope of telemedicine that's happened over the past 5 years. At Johns Hopkins, we've had over 2 million telemedicine visits. That's in comparison to 800 total pre-COVID in the outpatient setting. It's stated about 12% of our total outpatient volume. We have around 30,000 visits per month. About 10% of those are by telephone. And we've had visits across all specialties, including psychiatry, oncology, neurology, neurosurgery, genetics, and we have around 8 specialties who actually increased the amount of telemedicine they did over the past year. And we have studies and data demonstrating these services are clinically appropriate, high quality, and highly rated by our patients. And then the second point is just, as the chair mentioned, disparities in access to video versus telephone-based telehealth. Unfortunately, although we like to see our patients and have them see us, video telehealth is not accessible to all. And we've seen that the clear disparities that we documented at the beginning of COVID have persisted in 2024, while only 4% of our encounters with commercially insured patients were through telephone. 25% of encounters with Medicaid patients were via telephone or audio only. So this isn't just about convenience, but also about access and ensuring those who don't have access to video have access via telephone to their providers. And we really appreciate that Maryland has led the way in recognizing and continue to recognize the value of telehealth. And this bill makes sure we don't ever take a step backwards. At least 23 states have permanent parity laws. And so we're excited to have this law be permanent. And also the federal government, as of the recent 2025 fee schedule, has embraced parity payment through Medicare for video and for audio only. And Maryland should continue to do the same. So as a doctor, a patient, and a parent, I'm very grateful that telehealth is here to stay, and we urge a favorable report on Senate Bill 372. Thank you.
Anthony? Thank you. And first off, thank you, Madam Chair, for sponsoring this bill. Good afternoon, Mr. Vice Chair, members of the committee. My name is Anthony Roggio. I'm an emergency medicine physician at University of Maryland School of Medicine, and I'm medical director at the Center for Telehealth at the University of Maryland Medical System. I've been an emergency doctor for the last 13 years, and I've been involved in telehealth work for the last 7, and I've been leading UM's efforts to expand and improve telehealth services since the COVID pandemic. I'm here today also in strong support for SB 372, which is critical to our work at University of Maryland and for the health of Marylanders. Universities treated over 100,000 Marylanders in the last year using audio-only and video visits, in no small part to the previous versions of the Preserved Health Access Act. One patient in particular who shared her story with me, I think, serves as a really good example of how important telehealth can be. This was a mother of 2 in Baltimore who works during the day, and typical visits to the doctor's office for preventative medical care were not feasible. But telehealth allowed her the flexibility to take time during her lunch hour to access a primary care visit and obtain her medications for diabetes and hypertension. This is a visit she otherwise would have had to delay until she could take a sick day, which was not always feasible for her, or to come to the ER after work with her children to obtain care. I think it serves as an example of how for many Marylanders, the choice is not just between an in-person visit and a telehealth visit, but a telehealth visit versus a more expensive emergency or urgent care visit, or delayed care, or even no care at all. Many Marylanders face barriers to healthcare access, whether it's financial, transportation, insurance, or otherwise. And telehealth allows for the removal of these barriers, and it's no surprise that our data shows it's increased access for marginalized populations, younger women, patients on Medicaid, and even to Medicare populations. UMS has worked to integrate telehealth in multiple layers of our organization, using it to improve emergency department and hospital throughput, provide an alternative in cases of avoidable transfers and admissions, reduce healthcare costs, maintain flexibility during periods of short staffing, and provide patients a way to access high-quality inpatient and outpatient care regardless of the location or circumstances. By making expanded telehealth coverage and reimbursement parity permanent, SB 372 would enable healthcare providers to continue to expand healthcare access for Marylanders and innovate to continue to improve patient outcomes and save resources. We strongly encourage the committee to approve this package as a fair report.
Are there any questions of this panel? Seeing none, thank you all so very much.
Great job.
Thank you. I know there's 5 chairs there, but there's room for 6. I think one of them been pushed back, and we could bring that up. I'm gonna call the next 6 individuals: Damian Lang, Courtney Bergen, Nicole Granner, Laura Garcia, Drew Vetta, and Robin Elliott. See 5 of you, I called 6. Is Damian Lane at the table? Excellent. Courtney? Courtney's not here? Okay. Nicole?
That's me.
Okay, Laura? Okay. Drew? And of course, Robin. Excellent. Damian, you want to go ahead and get us started? Thank you.
Absolutely. Good afternoon, everyone. Madam Chair, Vice Chair Hayes, and members of the Senate Finance Committee. My name is Damian Lang, and I am the State Government Relations Director for Sheppard Pratt. Thank you for this opportunity to testify on this critical bill. I also thank the Chair and her co-sponsors for recognizing its importance. When COVID-19 began in Maryland, Sheppard Pratt worked tirelessly to ensure continued access to life-changing care. The pandemic significantly impacted mental health, but telehealth has been a game changer. In 2024, we provided over 200,000 telehealth services statewide. Patients prefer telehealth, which has outcomes identical to in-person care when clinically appropriate. Despite efforts to return clients to in-person visits, telehealth remains our highest volume service. If required to shift entirely to in-person care, we estimate losing 40% of our patients, many of whom struggle with conditions like anxiety, PTSD, and severe depression. Removing telehealth flexibility would create unnecessary barriers to care. Thanks to emergency orders enabling telehealth reimbursement, we have successfully expanded crisis services, outpatient mental health and addiction services, including psychiatric medication management, psychotherapy, addiction counseling, and case management. Today, 60% of outpatient appointments are virtual, serving over 10,000 patients statewide. Telehealth has helped thousands access care despite location, transportation, or other barriers. This has also eased the burden on emergency departments when beds are critically needed for acute care patients. Additionally, telehealth allows patients and families to maintain employment without missing work for in-person visits. Additionally, approximately 15% of our services are audio only, ensuring access for those without video technology. This is especially critical for historically marginalized communities, Medicaid recipients, the homeless, and those in crisis. Many clients have phones but lack video access. Without audio services, they would lose health treatment. For these reasons, Sheppard Pratt urges a favorable report on SB 372. Thank you.
Thank you so much for your testimony, Nicole.
Good afternoon, Vice Chair Hayes and members of the committee. My name is Nicole Grainer, and I am the Director of Government Affairs and Public Policy for the Community Behavioral Health Association of Maryland. Our 87 community-based provider members serve the majority of individuals who receive services in Maryland's public behavioral health system. I'm here today in strong support of Senate Bill 372, which will ensure continued access to telehealth services for Maryland's most vulnerable populations. You won't hear me talk much about the positive things that came out of COVID, but the increased use of telehealth and behavioral health is one of them. Maryland, like the rest of the country, is facing a behavioral health workforce crisis. We simply don't have enough providers to meet the growing demand for care. Telehealth, both audio and video, has been one of the most effective tools in expanding access to mental health and addiction services. It helps individuals who might otherwise struggle to get to care due to transportation challenges, financial barriers, or lack of broadband access, especially in rural areas. Video telehealth is a great option. However, many individuals in the public behavioral health system don't have reliable internet or smartphones. Audio-only telehealth is often their only connection to critical services like therapy and medication management. Without it, they may go without care, leading to worsening conditions and more costly interventions down the line. Senate Bill 372 also ensures continued rate parity between telehealth and in-person care. The same standards apply to both, and telehealth allows providers to reach individuals efficiently, making the best use of Maryland's limited behavioral health workforce. Telehealth has transformed behavioral health care in Maryland. It reduces barriers, improves outcomes, and is widely supported by both providers and clients. I respectfully urge the committee to give Senate Bill 372 a favorable report and keep these essential services available to those who need them most. Thank you. Of course.
Good afternoon, members of the committee. My name is Laura Garcia, and thank you for the opportunity to share some of my experiences with audio-only telehealth as a primary care provider and chief medical officer at Healthcare for the Homeless in Baltimore. I have worked at HCH for the last decade and can attest that one of the only silver linings from the COVID pandemic was the expansion of telehealth services more broadly to the American population. I would like to advocate today for the permanent continuation of audio-only telehealth services, which is a small yet crucial subset of the broader telehealth landscape that is particularly vital for my patient population, those experiencing housing instability. The challenges faced by these individuals are myriad, complex, and daunting. Audio-only telehealth services can be a lifeline for these populations, ensuring they receive the medical attention they need despite barriers to accessing traditional healthcare settings. Food insecurity, lack of reliable transportation, unemployment, no childcare, and concern about personal safety results in many competing priorities and ultimately barriers to accessing care. This only underscores the importance of a flexible and inclusive approach to healthcare. My patients often do not have access to the internet or data services through their mobile phones, but they are able to maintain phone services. By offering audio-only telehealth services, we can provide care that accommodates these challenging circumstances. This approach not only helps address immediate health needs, but also builds trust and continuity of care within these vulnerable communities. Almost 100% of our telehealth visits are completed audio-only. It is important to note that I can accomplish a significant amount over the phone. While this is not appropriate in all circumstances, there are many things that can be accomplished during an audio-only telehealth visit, such as managing diabetes, opiate use disorder, and ongoing therapy. These visits are not just phone calls and should not be considered as such. I would like to end by asking you to vote for Senate Bill 372, passing permanent audio-only telehealth as a critical tool in my toolbox to support the health and well-being of individuals who are already up against significant odds to lead a healthy life. Thank you.
Thank you. Thank you for your testimony, Drew.
Good afternoon. Thank you, Mr. Vice Chair. My name is Drew Vetter. I'm here on behalf of MedChi, the Maryland State Medical Society, to voice our strong support for this legislation extending telehealth coverage. We want to thank Chair Beidel for introducing this bill. We would note that this legislation ensures patients can continue accessing care where and when they need it, while also supporting the viability of medical practices across Maryland. As previous panelists have noted, healthcare access should not depend on where a patient lives or their ability to travel to appointments. For all of the reasons we've heard from the sponsor and the other panelists, MedChi is in strong support of this legislation. Thanks for your time. We urge a favorable report.
Thank you so much for your testimony. Robin Elliott.
Good afternoon, Mr. Vice Chair, members of the committee. Robin Elliott, here today representing a number of organizations in full support of this legislation. Telehealth simply works because it brings health care to people where they are. It doesn't require them to travel. It offers greater scheduling flexibility, and that's why it's been successful. The organizations that I represent that support this bill include the nurse midwives, the physician assistants, the school-based health centers, the school nurses, a group of federally qualified health centers called Maryland Community Health System, the Maryland Dental Action Coalition, Movable Feast, and the Coordinating Center. So you can see from that list the just breadth of types of providers that really value telehealth and how it's transformed their ability to engage their patients. Thank you very much.
Thank you. Are there any questions for this panel? Seeing none, thank you also very much. We have two signed up with favorable with amendments. That's Matt Calatano and Kimberly Robinson.
Of the broader telehealth landscape that is particularly vital for my patients.
Good afternoon, Mr. Vice Chair, members of the Senate Finance Committee. I'm here favorable today, but only to make a good impression on Senator Jackson. No, we are favorable with amendment on Senate Bill 372. Carriers are supportive of continuing the expansion of telehealth access brought on by the pandemic. The access that was created during the pandemic is something that patients have now adopted as part of their regular options as healthcare access for them, and something that we can't go backwards upon. While utilization has sort of returned to pre-pandemic levels, carriers are supportive of continuing the expansion of. He says it right. It's obviously still a useful option, and we can't go back. The only amendment we request is because of the ever-evolving technology in this space and the payment options, the new modalities are coming online. We would love the Healthcare Commission to be able to take a look at it every couple of years to make sure that we are keeping up with the current technologies, and my amendment is in my written letter of support. So thank you for the time.
Good afternoon, Mr. Vice Chair, members of the committee, Kimberly Robinson on behalf of Care First Blue Cross Blue Shield. Also favorable in support of the amendment that Mr. Celentano just described. We have worked hard over these years since the pandemic to expand access to telehealth. We definitely get favorable feedback from members who take advantage of that opportunity. And it is something that we know is going to become part of the fabric of how health services are received by the people that we insure. And so our request is, as Mr. Celentano described, we know that this is a space that's going to continue to evolve. And like all things, technology starts to evolve quicker and quicker. And to help make sure that we as a state are keeping our eye on that ball and we are able to come forward with bills at the right time as new modalities come online, as there's things about that cost proposition that shifts one way or another. If the Healthcare Commission continues to monitor this space, we'll provide valuable insight to this committee and your colleagues across the street to keep Maryland on the front end of the things that are happening here to the benefit of Marylanders. And so with that, we urge a favorable with amendment report.
Thank you so very much for your testimony. We have a virtual testimony coming from Patrick Savage Jr. Mr. Savage, if you would unmute, Dr. Savage, would you unmute and you may speak? Dr. Savage, calling Dr. Savage.
Are we good?
Yes, we can hear you loud and clear. Thank you so very much.
Thank you. The Honorable Chair Beidel, Vice Chair Hayes, and members of the Finance Committee, thank you for this opportunity to address you today. I am Dr. Pat Savage, a retired psychologist in Maryland, and I am testifying in strong support of Senate Bill 372 on behalf of more than 1,000 members of the Maryland Psychological Association. As you know, Bill 372 authorizes the ongoing use of audio-only telephone conversations and provides for reimbursement of telehealth at rates equivalent to in-person care. This bill maintains the access to care that many already rely upon to maintain their mental health. Why audio only? I and many colleagues have treated many patients who are elderly, technologically challenged, bedridden, people who suffer from neurological disorders or physical challenges, and people in crisis that make navigating virtual technology a challenge or impossible. Many lack internet resources, making access to virtual healthcare impossible, yet they very often can access care through a phone. Some can only create the privacy required for the provision of mental health services when they utilize a phone. Including audio only as a tool that can be utilized to deliver mental health care provides greater access to care that is vital to many's mental health. Why equality of payment? Mental health care in general is already inadequately reimbursed. An hour of time counseling a person is an hour of time whether the patient is seen in person, virtually, or spoken to by phone. Mental health care is reimbursed by the amount of time spent with a person, not by the technology utilized to deliver the care. Disincentivizing providers through lower rates to provide either audio-only or telehealth services will ultimately mean that some of our most vulnerable or difficult-to-reach populations do not receive the care they need. Given the dearth of mental health providers, we continue to need to be able to use the full array of technology to deliver care to those in need at reasonable levels of reimbursement. I'd like to thank Chair Beidel for introducing this bill. I ask that you provide a favorable report on SB 372 and keep the access to care door open as wide as possible in Maryland. Thank you for this opportunity to speak to you today.
Absolutely. Thank you for your testimony. Next, our virtual witness will hear from James Gutman. Mr. Gutman, you would need to take your mic off of mute in order for us to hear you. Mr. Gutman, are you with us? James Gutman, we could see a blank screen, but we cannot hear you because your microphone is on mute. And your camera's turned off. James Gutman, last call, and maybe we could come back around to you. Can we go to Christy Fogel, another virtual guest? Christy, you could take off mute and begin testimony when you're ready.
Thank you, Madam Chair and the Finance Committee members. Good afternoon. My name is Christy Fogel. For the record, I'm a physician assistant, clinician leader with LifeBridge Health Center for Virtual Care. At LifeBridge Health, we appreciate the opportunity to support Senate Bill 372. Since the pandemic, we have provided essential telesupport services to our patients, including post-acute discharge from the hospital, remote patient monitoring for chronic conditions, tele-urgent care, virtual nursing, and teleambulatory care. In 2024 alone, LifeBridge Health completed 43,000 telehealth visits across our system. The expansion of telehealth services has transformed our care delivery model and expanded access to care for our patients, especially those with transportation and mobility limitations. LifeBridge Health strongly supports the removal of the sunset of key telehealth flexibilities before they expire later this year to maintain patients' access to quality virtual care. The important key provisions of this bill will establish permanent policy regarding reimbursement of audio-only telehealth, parity reimbursement in the state. Although the use of telehealth was vital during the pandemic, these technologies have only increased in use to address provider shortages, expand access to somatic and behavioral health services, and to help address improved patient transition of care from the hospital. Continuing audio-only and parity reimbursement is essential to allow predictability and further adoption of technology as healthcare delivery continues to change over time. Fragmented policies at the federal and state level have often created more barriers to fully leverage these tools in previous years. Recognizing the value, we anticipate Congress to take action to support permanent extension of flexibilities. We also would recommend the committee consider revising Maryland laws related to behavioral health services to further align federal DEA guidance and flexibilities when allowing the use of telehealth. We have found significant improvements in adherence and reductions of missed appointments in caring for patients needing behavioral health services. LifeBridge appreciates this committee's commitment to ensuring the essential telehealth flexibilities are extended so that patients may continue to receive the access to essential, high-quality care that we provide them. Thank you for this hearing. We request a favorable report on Senate Bill 372.
Absolutely. Thank you for your testimony. James Gutman, were you able to work out the details? Okay, excellent. All right. Are there any questions for our witness? Seeing none, this ends the hearing on Senate Bill 372. Madam Chair, it's yours.
Thank you. Next, we have Senate Bill 355, Senator Hershey, the Family and Medical Leave Insurance Program Delay of Implementation. Yeah, and I'm looking to see if we have, do you want to bring your panel? You have two people, Kimberly Prescott and Fiona, and Fiona's virtual, but we'll hear from you and Kimberly first.
Thank you very much, Madam Chair and members of the committee. For the record, Senator Steve Hershey to present Senate Bill 355. Madam Chair, this bill quite simply is just an extension of the Family and Medical Leave Insurance Program that we passed in 2022. I am not up here to debate the merits of the bill any longer. We've done that a number of times, but this quite simply will just suggest or just require the Department of Labor to delay the implementation for 2 years. And why is this important? Well, frankly, as many of you remember, when Department of Labor came in, there was a number of conversations about whether or not MDL is ready to implement this program. And in September of last year, the Board of Public Works approved a $5 million contract for the marketing and advertising of this program. So that was just last September. Next week, the Board of Public Works is asking for an extension and an approval of for an expedited permit request for the financial management and accounting support to implement the family mandate. So again, just next week, we're still looking to procure the group that will provide financial and accounting support management. So obviously, that's not ready yet. Also, if you remember when we had our budget briefing from David Romans, we had asked about the requirement that the secretary suggested about hiring 369 new employees, new state employees, and if that had been approved. The budget right now has an allowance of $81 million to approve that request to hire. So those individuals have not been hired yet and are not on board to begin implementation of that. So one, it seems very clear that the state is not ready to move forward with the implementation of this. Second, the state cannot afford it. And again, in the budget briefing, we asked David very specifically, is there money in this year's fiscal budget to address the employer contributions from the state of Maryland, so that's from state employees, to implement the contributions that are necessary? There is no money in the budget to do that. So we have a concern, again, in this current fiscal crisis that we're in, with $3 billion of a structural deficit to make up, how the state is going to implement this program themselves with respects to the contributions made by the state and the employers and employees as well. And lastly, Madam Chair, this is just simply not the fiscal climate to impose a new tax on Maryland businesses. In the Department of General Services request to get the permit or the procurement changed, the department specifically says the Department of Labor faces an aggressive statutory timeline for implementing the family program. Formal regulations were published in 2024. Receipt of tax contributions will begin on July 1st, 2025, and claims processing and benefit payments will begin on July 1st, 2026. It is estimated by 2027 and 2028, family will annually receive approximately $2 billion in tax revenue. Madam Chair, this is a $2 billion tax on Maryland businesses and employees as well. And again, we just heard the state of the state today. We heard the drive for economic development and trying to bring new businesses into the state of Maryland. This is not the type of policies that we need to move forward with if we're trying to attract businesses and remain competitive with surrounding states. Madam Chair, there will be opposition to this bill, as you can imagine. I will state a few things about the opposition. One, this bill does not take away any benefits Marylanders are currently receiving. This program has not been started yet. So when we were talking about the budget and how we're going to make specific cuts to programs, this is the type of program we need to look at because it has not been implemented yet. This bill, again, simply delays that implementation. The other part of their opposition, this bill will not leave, this bill will not leave families without paid medical and family leave. As you all remember, we passed paid sick and safe leave a number of years ago. This was kind of a pile-on to that. Again, there's paid sick and safe leave. There's Federal Family Medical Leave Act, and this was just another layer of leave that Maryland legislature thought was important to include. So it does not leave any employees without paid sick leave. So to keep that in mind. And finally, Madam Chair, the other issue that came up was how the state of Department of Labor was going to start evaluating the options on which businesses could use. And those options of a state plan, a self-insured plan, and third-party insurance plans, again, have not been fully regulated yet and are not in a position where the state itself can make a decision on how they want to comply with the regulations of this program. So I'll leave with one final thing, and it just has to do with the numerous fiscal notes that we've seen on this bill since it's been passed in 2022, and would ask this body, who voted on this bill originally, did we ever really know what this program was going to cost us? In 2022, they said it could be $800 million. In 2024, it was changed to $900 million. Now we're seeing that it's over $1.8 billion. And that's because it's taken so long to finally try to figure out what this program was actually going to entail and how it was going to affect the state of Maryland directly. So again, Madam Chair, I would just say that it's important as we're looking at the fiscal climate of the state right now, as the counties are already getting burdened by some of the costs that the state is pushing down to them, this is the time to just put a brief 2-year extension, delay the implementation of this, provide some relief to the state in their budget concerns, provide relief to businesses that are trying to grow and looking at new tax climate as well. And I would ask that the committee approve this and vote favorably on Senate Bill 355. Thank you.
Thank you, Senator. Kimberly Prescott.
Good afternoon, Madam Chair, Vice Chair, and members of the committee. My name is Kimberly Prescott, and I am the president and founder of Prescott HR, an outsourced human resources firm based in Howard County. We support small and mid-sized businesses. These businesses represent the backbone of Maryland's economy and employ tens of thousands of workers across industries. I am also an employer to 9 employees. I am here today to express my strong support for Senate Bill 355. While the intent of family is commendable, the Department of Labor currently lacks the necessary infrastructure to effectively implement and manage this program. A delay would allow the department to establish a functional system. During this delay, I strongly urge the General Assembly to consider key amendments to the legislation. One being a minimum employer-based service requirement. Currently, family does not require a minimum service requirement at an employer, only that an employee be employed in the state of Maryland. The lack of service requirement creates challenges, especially for small businesses with high turnover and seasonal workforces. Adding this requirement would prevent unintended disruptions and ensure certain businesses are not disproportionately impacted. Second, aligning the definition of family member more closely with the federal FMLA. Under the current family framework, employees can take leave for reasons beyond what FMLA allows. This could result in employers struggling to operate while covering for employees on leave for up to 24 weeks in a single year. Many businesses do not have the workforce depth to absorb such prolonged absences. Maryland's businesses need programs that are clear and manageable. This bill allows an opportunity to refine family before its implementation, ensuring it works for both employees and employers. I urge the committee to support this bill and to consider these amendments to improve the program's effectiveness. Thank you for your time.
Thank you. We have one more panel member virtually, Fiona Ong. You can start, Ms. Ong.
Thank you, Madam Chair. And thank you to the Vice Chair and honorable members of the committee. I am Fiona Ong, a shareholder at Ogletree Deacons, and I want to thank Senator Hershey for inviting me here today. I've represented employers for over 30 years, and I've worked closely with them on a lot of leave issues. I've also testified on prior family bills and have been actively participating in the Family Division's extended regulatory process. I want to focus on 2 main problems with the family program for employers: insufficient time to prepare and the inability to challenge a fraudulent or improper award of benefits. In terms of the lack of preparation, we are less than 3 months out from May 1st, when employers are supposed to start filing a declaration of intent to have an equivalent private insurance plan. We are less than 5 months out from July 1st, when contributions begin. Not all the proposed regulations have been released, as others have said, and certainly not the final regulations to implement the law. And employers need time to prepare. They need to figure out the systems to ensure that the proper deductions are being made and held. And this can be challenging and time-consuming, particularly for large employers with complicated payroll systems for thousands of employees. They also need time to figure out if they're going to use a state program or choose to use an equivalent private insurance plan. But they don't even know what those plan requirements are going to be. And there are no commercial insurance plans available yet. Those will need to be compliant with insurance laws and regulations as well as family. And insurance companies are going to need time to develop such plans, and employers are going to need time to consider them. As to my second concern, there's no formal procedure at this point that allows an employer to challenge benefits that were fraudulently or improperly awarded. And unfortunately, in my practice, we've seen many instances of employees abusing sick and safe leave, leave under the Federal Family and Medical Leave Act, and leave as a reasonable accommodation under the Americans with Disabilities Act. And all of those laws have provisions that enable an employer to verify the legitimacy and the need for the need and use of leave, but they also enable the employer to take appropriate and immediate action where employees have lied about the leave. But here there's no mechanism in place or even proposed where an employer can formally challenge employee fraud or allow an employer to challenge an award where benefits were mistakenly awarded. And those need to be put in place. So for those reasons, I urge this committee to issue a favorable report in favor of Senate Bill 355 to delay implementation of the family program and allow the Department of Labor and employers the time to put an effective and well-designed program in place. Thank you.
Thank you. Thank you to the sponsor and to this panel. Do I have questions? Any questions for this? Oh, Senator Reedy?
Can I just, maybe it's Fiona could ask this question too. I know it's virtual, but what are some of the in addition to the fiscal side of this, what would be some of the benefits from a kind of a business standpoint to delaying this a little bit further?
Well, I think Senator Hershey put his finger right on it. It is a very difficult economic climate, and we're talking about this is a pretty significant tax for employers. I was speaking with one of my clients that is a larger employer, and they were saying that this would be in excess of $2 million a year that they would have to contribute for their employees. And they're a nonprofit. So, that's a pretty significant bite out of their budget.
And just as a follow-up, so it's a tax we know on the actual job creator or business or nonprofit, and it's also a tax coming out of every worker's paycheck. And so we just actually had a speech from our governor in the annual State of the State where we talked about wanting to invest in economic growth. Are you aware of companies that have decided to not maybe put a location here or not hire Maryland workers because of this? I've actually heard anecdotally of some folks who were up for a job and didn't get it because it was like, this is going to be an additional thing we have to do. That may not matter for like big multinational corporations, but for a lot of sort of medium-sized businesses, is it your experience that could be a factor in even getting Marylanders to be employed with good jobs?
Absolutely, Senator. We are hearing that from some clients that they either want to pull out of Maryland or that employers in other states have no interest in coming into Maryland because of this issue.
Okay, thank you very much. Thank you, Madam Chair.
Thank you, Senator Reedy. Senator Mounts?
Thank you, Madam Chair. Senator Hershey, thank you for bringing this legislation. Full disclosure, I didn't support it when it went through. I had concerns with it, but I strongly support the intent of what it does. It's great policy, but I've always had problems with the inner workings of the way this was put together. Excuse me. But Mrs. Prescott, are you familiar with this contract that's being rushed to the BPW, the accounting and financial support contract? Are you familiar with that?
No.
So you don't know what that would do, what function that would what function that would provide in the creation of this program in the department?
I'm not aware of what you're speaking about specifically, but what I do know in conversations that have been had with the family division of DOL, there are some significant challenges with software, how it will be implemented, and how they would manage the program. But I'm not familiar with what you're speaking about specifically.
Okay. I remember when this was created, and the analogy was the Maryland Saves Act. And that was a legislation that was like a tenth the size of this legislation. It was supposed to be rolled out within 2 years, and I think it took 12 years. In fact, people would talk to me about that legislation who were long out of the legislature, and they said, Johnny, what you're considering is similar, except it's much larger. And you mentioned the minimum, the service requirement, the minimum employer service requirement. did you say that that is not in place right now? That is not defined right now? Was that not included in the legislation? Because I know there was a lot of latitude when the bill was put together for the department to formalize these things. Just a quick question, I have a follow-up on that.
So the bill states that that it's portable, and so the Department of Labor has interpreted portability to mean that if they've worked at all in the state of Maryland and not any period of time for a specific employer.
And so that is already established, or it has not been established?
The Department of Labor in the regulations that they have released have said that it would be if you worked the 860 hours in the state of Maryland, but and when asked specifically whether there was an employer requirement, they specifically said no, it is portable, and if you worked in the state of Maryland and not for a specific employer.
In my district, there are many small businesses. They don't have the luxury of having an HR expert to help them manage their affairs. They use things called Post-its and stickies and pins. You do this for a living. Can you break that down for me to try to explain the complexity of the scenario this creates for not just the employer? This is about the employees. You know, we just had bills about people not being paid enough. And so we're talking about this program coming live. How are the employees supposed to know what they're entitled to? And can you just break that down for me a little bit?
Currently, the Department of Labor has given some, guidance. There will be posters, some of the things that they typically provide to employers and employees so that they can understand the rights. I'm not sure what their plan is to communicate it to the employees. It is my belief that they believe that the employer should be providing this requirement. But as has been the case with many other pieces of legislation that we've seen go through, many times employers are not aware that these are the requirements.
Yeah, so in your experience, you deal with this. There's payroll issues. How often do you run into a situation where there's an employee that's not aware of, I mean, we have longstanding labor laws and there are deductions from pay stubs and things like that. How often in your course of business do you encounter situations with our existing programs are in place where there's an employee or an employer that's confused about what's supposed to be paid or what's supposed to be received?
I think that the one thing that I see the most, and I think, well, I will say this, much of the challenge is the varying definition of a small employer, how it applies, the number of employees it applies to, right? Mm-hmm. So each piece of legislation has a different threshold, which makes it very difficult for employers in Maryland to navigate, particularly smaller employers with no dedicated HR. I will also say that, as it relates to payroll specifically, I can't speak to that. Our clients haven't necessarily encountered that, but some of it has been that they just were not aware of some of the particular leaves, but I can't speak to payroll specifically.
Okay. And how are we defining family member? And is it defined in the legislation that was passed? I should know that because we all voted on it, so guilty as charged. But is it defined in the legislation, or is that defined by the Department of Labor?
It's defined in the legislation. I know Fiona can give some additional context, but it is defined, and it is a very broad definition.
And we were talking earlier about the need to delay the implementation. The concept that there are 389 individuals that still need to be hired. When this is supposed to become active at what time?
Deductions are scheduled to begin July of this year.
July of this year. Right. And there's still 400 individuals. Are you aware in what function or capacity those individuals are intended to perform duties?
I believe it's the entire department, but I'm sure someone else can speak to that.
Well, I've got a lot of questions about this program that's being created, and I'm only allowed to ask one question to one witness, right?
Senator, I just want to remind you, the sponsor started out with a comment, this is not to discuss the merits of the bill, it's just to delay it. So if we could.
Okay.
Thank you.
Thank you for the opportunity to pose
Thank
some
you,
questions.
Senator. I always appreciate your respect to the rules. Senator Guile?
Thank you, Madam Chair. I just wanted to clarify something, Senator, that you said earlier. I think you said that the family, like the Maryland's paid family leave law, that's just another layer, that this doesn't mean that employees are not going to be without any sort of paid family or paid leave, I guess, that there's sick and safe leave, and then there's FMLA. Just to be clear, FMLA is not paid leave, correct?
No.
That's correct. What I'm saying is correct?
Right.
That's correct. Okay, so it's not paid. It's unpaid leave, right? Okay.
That's if they get to that, if they've already, I guess, exhausted the paid sick and safe leave that they've been provided by their employer.
But FMLA leave is unpaid leave, right? And it doesn't cover all workers, right?
Oh, no.
Okay.
Federal
Well,
program.
okay. And then sick and safe leave, what's the most amount of leave you can get under that? Do you know?
I think we said 2 weeks.
2 weeks?
Is that it? Yeah.
So if a woman gives birth, for example, all she would get would be like 2 weeks off of paid leave during that time? Okay. All right. Thank you very much, Senator. Appreciate it. Thank you, Madam Chair.
I don't see any other questions. Oh, Senator Hayes, I should then.
Thank you, Madam Chair. Ms. Prescott, in your testimony, you testified that the agency doesn't have the capacity to operate this. What evidence do you have of that?
The fact that the division hasn't hired the number of employees that they need to hire. Additionally, recently they have they recently canceled one of their public forums that they were supposed to have. But
I got it. Yeah, I'm talking about the capacity to actually run it. So the Department of Labor, in their last couple of times testifying on behalf of the legislation, they identified that they did. You said that they didn't. So I'm trying to figure out where the discrepancy is.
It is my understanding that the software that they need to manage the program has not been procured.
Got you. Okay. And also, did you have a chance to testify when the sick and safe leave came before this committee?
In 2017?
Correct. Did you support that legislation, sick and safe?
Well, I was not involved at this level in 2017.
Did you support the legislation to raise the minimum wage here in the state?
I was not involved in that.
All right. And did you come and testify on the family leave bill either?
I didn't come in person, but I did through a chamber, yes.
Right. And so what did you testify in that situation?
What did I testify?
Did you testify favorable or unfavorable at that time?
Through the chamber, I don't remember what the formal.
The formal testimony on behalf of the chamber was unfavorable. And so what I'm getting at is, you know, there's been plenty of people that's testified in front of this committee, and the fact that having paid family leave provides an opportunity for caregivers and others to take care of their families. There's been small businesses that's testified in front of this committee that, you know, it is a compliment and a morale builder for those who work for those employers. I would assert that your testimony today is just a continuation of a debate that's already been decided by this General Assembly to have it and not necessarily to delay it. And so I understand and respect your position, but I think at some point we will, you know, have to make some tough decisions as how we go forward. But, you know, it bothers me that we use this opportunity as an opportunity to re-argue the position that the legislature's already taken. Thank you, Madam Chair.
Thank you, Mr. Vice Chair. Seeing no other questions, that ends this panel. We have 3 more favorable: Michael Halloran, Grayson Wiggins, and Kelly Locklear. Surprise there.
Hey, good afternoon, Madam Chair, Mr. Vice Chair, members of the Senate Finance Committee. For the record, my name is Mike O'Halloran, here today representing National Federation of Independent Business here in support of Senate Bill 355. You know, we certainly appreciate the Senator putting this bill forward. It is a reprieve, albeit temporary, from a new payroll tax that, you know, up until, you know, without the passage of this bill or some other mechanism is scheduled to go into effect this July 1. So I actually went back to my notes, speaking of the prior sessions, but I went back to my notes from 2022 and noted that advocates at that time claimed it would cost roughly an employee $3.62 per week out of their paycheck. And I remember I also went further and said, for a small business owner who has roughly 20 employees, that's about $72.40 per week, which further, $3,764.80 per year if my Catholic school math is anything to go by. The reality is this program's costs have increased and increased dramatically since the legislature created this program. The fiscal note from 2022 estimated roughly $800 million in payroll taxes collected in FY26. This bill's fiscal note estimates $1.3 billion in payroll taxes will be missing with the passage of this bill. So what that means is roughly $500 million is actually the difference between what we thought it was going to cost in 2022 to what now folks are saying is going to cost. So I say that to frame, a lot of the debate this session is going to be around fiscal issues, and rightly so. Now is not the time to levy this payroll tax on employers and their employees. We think that a 2-year delay is fair and reasonable, particularly given some of the back and forth that the business community is having with the department, and I dare say even the advocates are probably having with the department around regulations. So with that, we respectfully request a favorable report for Senate Bill 355. Thank you.
Good afternoon, honorable members of the Senate Finance Committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Alliance, and we are here in support of the legislation as well. I actually just wanted to maybe give some perspective from other states that experience challenges here. So Connecticut, Massachusetts, and Washington were all states that launched before they were ready, and they experienced claim backlogs, which then negatively impacted employees. So in those states where I have multi-state operators, where they rely on the state to administer these benefits, they've seen employees return to work before receiving benefits from the state. And this is a very difficult position to put them in if you do not have the savings to stay afloat and or do not have supplemental benefits from your employer to ease the burden. So I wanted to give a little more perspective on what's occurred in other states when they've moved forward with the program and we're not ready to do so. I will also mention, and it is something that I testified to previously, that the state had to put millions of dollars in some of these programs because of solvency issues. So with that, we are here in full support. I'm glad to answer any questions. Thank you.
Thank you. And Grayson?
Good afternoon, Madam Chair, members of the committee. Grayson Wiggins here on behalf of the Maryland Chamber of Commerce. I think I'm going to talk about some of the open-ended questions with the program currently. So I know the department has testified before this committee earlier this year. In their letter of information, they list out 7 bullet points that they're still working on. And these things include building digital systems, establishing bulk uploading capabilities, secure banking capabilities, digital and financial systems. And so my understanding, just in meetings that we've had with the department that have been open to the public, is that there is still a long way to go with the program. And outside of the operational issues, the regulations have still not been finalized. And I think some of the questions that Ms. Prescott was raising were relevant because they are pertinent to these regulations that are still open. And there's questions regarding, what happens when an employee crosses a state line? Are they covered by this? And the regs say it's incidental, but it doesn't define incidental. In addition to the regs, as Mr. O'Halloran pointed out, the fiscal notes don't align. They just don't. And in addition to that, when the Department of Labor put out their regulations for public comment, they indicated there would be no fiscal impact despite those regulations, including the contribution rates, which is odd to me. And I would just note, in addition to the fiscal notes, there is a recent document that was submitted by the Department of General Services to BPW that doesn't quote $1.3 billion, as Mr. O'Halloran said, but instead quotes $2 billion as the cost of the program. And so we're trying to ascertain what the cost is going to be when we take this money out of the economy, and we're trying to ascertain where we're at with these 7 bullet points. And for that reason, that's why we're at the table today, Madam Chair.
Thank you. Do I have any questions for this panel? I don't see any questions. Thank you for your testimony. We have 4 unfavorables: Lisa Klingemeyer, Lucy Zhao, Christopher Cano, and Callie Schmitz. Huh. Everybody still here? You can start.
Thank you, Madam Chair and members of the committee. My name is Lisa Klingemeyer. I'm the Deputy Director of Policy at Maryland Family Network, and I'm the campaign manager of the Time to Care Coalition. We thank you for your time today. We're here today in strong opposition of Senate Bill S355. I want to thank this committee for its great work to pass the Time to Care Act, particularly our champion, Vice Chair Hayes, for all the great work on that legislation. And if the legislation had gone into effect on a timeline it was supposed to, we would actually have paid family and medical leave today. But as it is, this program has already been delayed twice, and Marylanders cannot afford any more delays. The actuarial study that the department had done found that approximately 160,000 Marylanders will apply for leave under this program in a year. So every year this program is delayed means 160,000 Marylanders are going without the paid leave that they need. Yesterday was World Cancer Day, and 32,000 Marylanders are diagnosed with cancer each year. And in 2022, I was one of those Marylanders. And I can tell you what it feels like when you get a phone call that says you have cancer, and your heart stops, and your breath catches, and you try to figure out how to keep breathing because you need to breathe to live. But then you wonder if you're going to even live through this diagnosis. You ponder calling your parents and having to tell them their daughter's been diagnosed with cancer, calling your friends, calling your employer. You start pondering, what's the treatment going to be? Do I need surgery? What is my recovery going to look like? What's my insurance going to pay? And I cannot imagine for the 64,000 Marylanders who, if this bill were to go into effect, who are going to be diagnosed with cancer over those 2 years, the majority of whom likely do not have access to paid family and medical leave, because most workers do not. FMLA is unpaid. It only applies to businesses with large people. Sick and safe leave is 5 days, if you're lucky to work at a business of 15 and more people, and you work full time. So for those Marylanders, they'll be asking possible questions like, can I keep a roof over my head through this diagnosis? Will I be able to feed my family while I'm going through chemotherapy? So for the hundreds of thousands of Marylanders who've been waiting for this, who call me as the Time to Care Manager campaign manager asking about this, we respectfully request an unfavorable report to keep with the current timeline, and we thank you for your time.
Lucy, you want to go next?
Good afternoon, Madam Chair and members of the committee. I apologize, I've lost my voice a little bit. My name is Lucy Zhou. I'm here on behalf of the Public Justice Center in opposition to SB 355. Prompt implementation of the family program is critical to helping alleviate the financial hardship that families face during life's challenging and milestone moments. I was fortunate to have paid parental leave provided by my employer when I had a baby this past summer. It was a relief to be able to focus on my own health and that of my newborn without the stress of having to spend down all my sick and vacation time or feeling financial pressure to return to work before I was physically and emotionally ready. Even though I feel lucky to have had access to paid parental leave, this critical right should not be a matter of luck. The vast majority of private sector workers, and particularly the lowest wage workers, do not have access to paid family leave. Expanding access to paid leave has substantial positive effects on workers and businesses alike, and delaying implementation means delaying the realization of these positive effects. Also, to offer a little bit of perspective on this bill, as you know, the bill would delay the implementation of the family program by another 2 years. This would make Maryland's implementation timeline from statutory enactment in 2022 to the start of benefits payments in 2028 more than 6 years long. This would make Maryland an outlier compared to every other state with paid leave. Every other state with a fully implemented paid leave program has been able to complete implementation in less time, generally 4 years or less. Maryland should be able to implement its program on a comparable timeline to these other states, especially given that we have the experiences of these other states to draw upon and can learn from the challenges and mistakes that have occurred in other states. The timeline for this program has already been delayed twice. We don't believe further delays are justified, and for that reason, I respectfully request an unfavorable report. Thank you.
Thank you. Kelly, you want to go next?
Thank you, Chair Beidel and members of the committee. My name is Callie Schubitz. I'm Vice President for External Relations at the Maryland Center on Economic Policy. I'm normally here sharing data and discussing the economic impact of policy proposals, but today I believe the best way I can explain the economic impact is through my own family story. Last year, my husband lost both of his parents, and he was the sole caregiver for his father in the last year of his life as his health began to decline. In addition to the significant emotional toll, going through this meant many days off work for doctor's visits and weeks off work for hospital stays and dealing with all the logistics of the ends of a parent's life. My husband is a carpenter, and if he is not physically at his shop working, he does not get paid. So this also meant the loss of thousands of dollars in income and the stress that goes along with that. We are fortunate that we have had the income and savings to avoid serious hardship and that my husband's employer was understanding and didn't fire him, which is not always a given in his industry. We were never at risk of going hungry or not being able to pay our mortgage, but many other Marylanders are not so fortunate. They can end up homeless or in need of support from the state's safety net programs when they face similar situations. But losing significant income still meant that we were not dining out, we were buying less, we were paying less in taxes. Multiply that impact by the tens of thousands of Marylanders experiencing similar life events every year, and you can see the significant positive impact that paid family and medical leave will have on our economy. If the paid family and medical leave program was in place, my husband would have been able to take paid leave when he needed it last year. My family would have had one less stress during an incredibly challenging period. I would have gladly had a couple of dollars taken out of my paycheck each week so that those thousands of dollars in paid leave were there when we really needed it. Maryland families and our economy cannot afford any more delays, and our state cannot afford to fall farther behind as more and more states implement paid leave programs ahead of us. Paid family and medical leave will support a growing economy, and I strongly urge you to reject Senate Bill 355. Thank you.
Thank you. And finally, Christopher.
Yes. Christopher Connell, Director of Political and Legislative Affairs for SEIU Local 500, which represents over 23,000 workers here in Maryland. You know, just like Callie, I usually speak on behalf of other people, but today I wanted to speak on behalf of my family. My son here, Jean Carlos, is 8 months old today. And the fact of the matter is that my wife and myself have spent quite a few times, quite a few weeks, quite a few months raising him, helping him, adjust here on the earth. And of course, if it wasn't for my union being a part of this Time to Care Act coalition and actually voluntarily set a policy at my job for paid family leave, I don't know what I would have done to support my wife, who had major complications, who her and him almost didn't make it through the birth. And here we are today, lucky, but like Callie said, there are tens of thousands of other families in this state that are going to suffer. And whether you all don't have the political will or it's about fear, it seems to be a lot about money. But the fact of the matter is that for most of us, money is going to impact us, that Maryland families are the backbone of this economy. And the families need your support right now. And if you don't have that political will, I want you to look him in the face and tell him that it's okay, that sacrificing his emotional, social well-being is okay to save a few dollars, to pinch a few coins, because it's not. And the fact of the matter is that our governor just applauded that Maryland has one of the highest rates of women returning to the workforce. So are we going to go backwards? Do I got to tell his mom she needs to go back? Because right now I'm carrying all the load. I'm carrying all the bills. I have this burden on my shoulder as a man, and I'm willing to shoulder that. But does she need to shoulder that? And how many moms out there are shouldering it by themselves? So this is vital. My own father was diagnosed with terminal dementia, and I can tell you, I lost plenty of money trying to take care of him. My mother had cancer, and our family took major impacts, and we were in Florida at the time. Now I'm here, and now I'm grateful that you all have forward thinking as public policymakers. So I ask you to reject this bill.
Thank you, Christopher. Thanks for, what's your little guy's name?
Jean Carlos.
John Carlos, thank you for bringing John to visit.
Hey, buddy.
And training him to be a political activist, right?
I'm going to take him outside, but
okay.
if y'all want to give me questions.
Thank you.
Come back.
Any questions for this panel? Senator Hershey.
Thank you, Madam Chair. Ms. Klingenmeyer, just again, not to debate the merits of the policy, but simply, again, the bill is an extension and delay because of the readiness and affordability of the program. You did mention, obviously, this law passed in 2022. It was delayed in 2023 and 2024, and this is from your letter of opposition, and it was the same testimony that SEIU 500, same exact sentence. I just want to make sure this is accurate. You said, "Our coalition supported those delays as they were necessary to ensure Department of Labor had adequate time to build the systems and the teams needed to accept contributions and pay out benefits." That's accurate statement?
Yes.
Okay, all right, that's all. Thank you very much. Thank you, Madam Chair.
I don't see any other questions. That ends this hearing for Senate Bill 355. Thank you. Is Senator Solling here? Okay. Senator Solling, Senate Bill 119, Maryland Transportation Authority, Francis Scott Key. And you do not have a panel, it's just you. Thank you.
Good afternoon, Madam Chair, Vice Chair, and Finance Committee. For the record, I'm Senator John Ray Salling from Baltimore County. I want to say welcome to my new friend, new senator. Senate Bill 119 just simply codifies in law that the name of the collapsed Francis Scott Key Memorial Bridge remain the Francis Scott Key Memorial Bridge once again, and once it's rebuilt. Early in the morning of March the 26th, 2024, I and many others awoke of the shocking news of the collapse of the Francis Scott Key Bridge. It was hard to believe that such a historic and iconic bridge was gone in a matter of seconds, and I prayed for the families of those who we lost. In the following days and weeks, we were a witness to the resilience of the people in Baltimore, and I am appreciative of the efforts of the General Assembly, the governor, our federal government, the state, and our local partners who made it a priority to address this issue and the support of our local community. The Francis Scott Key Bridge was an iconic symbol. And in the city of Baltimore and in the state of Maryland, it represents not only deep history in our state and in our country, but also our economy and the working class communities of Baltimore. Over the course of its lifespan, the Key Bridge carried millions of people and served as a link for goods, vehicles, income in and outcoming at the Baltimore port, where thousands of Marylanders were living and helped grow our economy. I hope you will join me in honoring the legacy of the Key Bridge by supporting this bill and codifying that name remain the Francis Scott Key Memorial Bridge. I'm going to thank you for this opportunity and for this privilege to represent, first of all, the Key Bridge area, but talking about this bill. And I'm more than happy to answer any questions. And thank you, Madam Chair.
My Vice Chair has a question.
Thank you, Madam Chair. Senator Solling, how did the bridge get the name in the first place? Was it by statute? Is it written in statute, the name?
I honestly could get that information for you. All I know is that the time, just the history of the Key, of Francis Scott Key and what he stood for, or being there back in the day of, I can tell you right now, I just brought this up. In September 14th, 1814, where originally was named a defender of, the song was named that, he written the song of the National Anthem, of course. And it was published by name, but it was changed. But other than that, I have no other history than that. But I know the federal government did codify it, and I'm just trying to do in the state. So that's all I know.
I would just be hesitant to put in statute. When we talk about history and symbolism, it means a lot to a lot of different people. And, I think leaving well enough alone would just be good enough. I think putting it in statute may bring up some other issues that would diminish the moment that you're trying to celebrate.
I understand what you're saying, but I don't know how long. I think it's been since the 1970s when they did build the bridge. The people that live around me, and I believe live around you, I've met people that built the bridge. I talked with them. When that happened, they were unbelievably so sad, because their heart and soul and sweat went into that bridge. And then when it was named that, they were very, very proud, and they're still proud today. And all they were saying was it was like in their heart a priority if we can still continue that name of Memorial Bridge. So that's why, one of the reasons why I'm doing this. But I understand.
I hear you loud and clear. I think putting it in the statute will bring up a nasty history here in the state of Maryland that we don't want to necessarily bring attention to.
I understand what
In
you're
the
saying.
name. Thank you so very much.
Thank you.
Thank you, Senator. I see no other questions. That ends the hearing on Senate Bill 119.
Thank you very much.
Thank you for sharing that picture yesterday of the bridge. It's beautiful.
Thank you. I'm glad. I hope if anybody did not get it, I could send it to them. If you didn't get it, I'll send it to you.
Yeah.
I'll send it to you.
Thank you, Senator.
Thanks, ma'am.
Now, Senate Bill 279, Senator Simon Ayer. See, there he is. Senator Simon Ayer's bill is Employment and Insurance Equality for Service Members Act. And you do not have a panel. It's just you, Senator. Thank you.
Thank you, Madam Chair. For the record, Senator Brian Simon Ayer, Senate Bill 279, and I am the only witness by design. You can look at your written testimony. I basically had them put in written testimony. As you'll recall, I had a presentation previously that went over the structure, how it's completely restructured Maryland military law and establishing consistent equal benefits. It was a PowerPoint, beautifully done. But since you have that, I'm not going to go over that. But I do want to say I'm working with the department and the governor's office. We should have some clarifying amendments coming. And over the interim, I worked with the Maryland Insurance Administration, the Department of Labor, PHS, NOAA, and others on this consensus legislation. So Senate Bill 279 is one piece of that package. Again, we're not trying to change the underlying policy, but just make it equal for all branches. And it hits many different articles: economic and development article, the financial institutions, insurance, labor and employment. Give you some examples. It updates the expediting licenses so it applies to all 8 branches, the underwriting discrimination protections for all 8 branches. There is one provision in Insurance 10-111 that, working with the drafters, there's a reference that should be taken out because of a bill last year that passed. So that's just cleanup. And labor and employment, considerations for deployment of service members, that's equally applied to all 8 branches. I could go into great detail, but I will leave it at that and ask for your favorable consideration.
Well, that was nice and short, Senator. Thank you. Do I have any questions for Senator Simon Ayer on this bill? Seeing no questions, that ends the hearing on Senate Bill 314.
Thank you.
Thank you. I'm sorry, not 314. I turned the page. Senate Bill 279. You were letting it go at 314. Thank you, Senator. Okay, now we will begin the hearing on Senate Bill 314. Senator Lamb is not here, so what do we do, Madam? We're going to wait just a few minutes. I think Senator Lamb is testifying in another committee. Senator Lamb, thank you for joining us. We don't see Senator Love. Have we reached out? Yeah. Okay. Give me 1 second. Should we start, you think? I think so. Okay. So, Senator Lamb, you have a panel: Charlotte Hoffman, MPs Eric Gold, and Kellen Sweeney, if you'd like to bring up your panel.
Sure. I think they're all coming in the door right now.
Okay,
All right.
thank you.
While folks get situated, I'll go ahead and get started. Good afternoon, Chair Beidle, members of the Senate Finance Committee. Pleased to be here to testify and introduce Senate Bill 314. For the record, Clarence Lamb, Senator in District 12. This bill will, we believe, have a profound impact on Marylanders in many ways across many districts throughout the state. This bill makes three main changes in how Marylanders may update their birth certificate or birth certification of their child. The first thing this bill does is require the Maryland Department of Health to update a birth certificate if the department receives a valid name change via court order. Additionally, the bill clarifies that if a patient has a name change, then the child's birth certificate shall have the parent's current name and cannot reference the parent's former name. Except for instances following marriage, there is no clear process for a parent to update their child's birth certificate if the parent changes their own name. This is important because having your child's birth certificate not match your own legal documentation can lead to a variety of other issues, including difficulties with school enrollment. This would help parents who are changing their name to better reflect their gender or for other reasons such as fleeing domestic violence. The second primary change for this bill makes is streamlining the process on changing the sex designation on a birth certificate. Currently, in order to change the sex designation on a birth certificate, an individual must be undergoing gender-affirming treatment. This is an unnecessary step in the process that creates extra burdens for Marylanders with less access to medical care. We believe that requiring an individual to affirm under the threat of perjury that the sex on their birth certificate needs to be updated is sufficient. We currently allow Marylanders to update their driver's license, and this will ensure that individuals can have their birth certificates align with those other state documents. Finally, this bill adds a third sex marker that can be selected for reissued birth certificates. We currently allow, for example, X as a marker on driver's licenses in Maryland, and until recently, the federal government also allowed X on passports. Additionally, while passports last for 10 years, thankfully, many people will get their X marker well past the current administration. The ability to select an X marker here will ensure that Marylanders will also have the ability to uniformly designate their sex throughout their documentation's likely lifespan. In addition to supporting transgender Marylanders, this option could be helpful for those who are living with intersex conditions whose physician at birth assigned them male or female, but as they grew up, they learned that they had an intersex condition. This bill is not making any significant changes to any processes that we currently have, and the department should have no difficulty implementing it. But as you will hear from this panel, it is really important for many Marylanders to have consistency across all of their legal documentation to protect them from discrimination, violence, and undue administrative burden. And with that, let me turn it over to members of the panel here and request a favorable report.
Thank you, Chair, Vice Chair, members of the committee. I am Charlotte Persephone Hoffman. I am the Policy Director with Trans Maryland, and it is a pleasure to be here speaking on behalf of SB 314. So I think that it's really crucial that we remember that this is an administrative bill. It's fixing some procedural things in the birth certificate laws that they're largely vestiges of prior times. They're, leftovers from when we've previously tried to tweak things and, just sort of left things behind. So there's literally one change in here there's a change to the MVA section where a word is being changed from other to another. It's like a lot of these changes are very straightforward, easy to explain things. But I want to explain how important this is to transgender Marylanders and our families, to be able to have documents that represent who we are as people and who connect us to our children, our parents, et cetera. And especially in the current political environment where transgender folks are feeling especially under attack from the federal government, having documentation from the state of Maryland that says we recognize you and we recognize who you are is just crucial to feeling that we are recognized as human beings. So as Senator Lamb said, the changes are, facilitating transgender folks updating their information on their children's birth certificates. This is actually what how this bill came about. We had parents coming to us who said, I can't change my information on my kid's birth certificate, and so I have to carry a whole stack of documents with me to prove that I'm the person that's named there. And we want to ease that process. So thank you very much, and I urge a favorable report.
Thank you, Charlotte. Who wants to go next?
I will. Your Chair, Vice Chair, my name is Eric Gold. I'm a partner with the law firm Manat, Phelps & Phillips. Prior to joining Manat, I was chief of the Healthcare Division at the Massachusetts Attorney General's Office. At Manat, I provide state regulatory counsel to our clients, including Trans Maryland, who's a pro bono client of our firm. So the Senate Bill 314 would modernize Maryland's processes and rules for changing gender markers on birth certificates. As you've heard, this is a quite simple and straightforward piece of legislation. I just want to make 4 quick points. First is that the bill would allow the use of X markers on the birth certificate. Maryland already allows this for driver's licenses, and this change would bring Maryland's laws in alignment with the laws in 16 other states that we cite in my written testimony. Those states include Colorado, Nevada, New Mexico, and Utah, among others. The second point is that the bill would eliminate the need for a special medical certification to change the gender marker. Again, 14 other states already allow this, including Idaho, Maine, New Jersey, and Washington. Third, it would allow for birth certificates or ensure that they are not marked as amended. And of the 14 states that allow those changes without medical documentation, 5 others already do not mark amended, including those are California, Michigan, Nevada, New Jersey, and Vermont. Lastly, just to note that my team and I have scanned the public record for incidents of reports of fraud or criminal behavior related to changing gender markers and haven't found any. So again, this is a straightforward law that will make the lives of trans Marylanders easier without any adverse effects. And I thank you for the opportunity to testify and urge a favorable report on the bill as well. Thank you.
And who's next?
All right, yes, I will be next. Thank you, Honorable Chair, Vice Chair, and committee members. My name is M. Pease. I use they and them pronouns, and I'm testifying as Director of Research and Assessment with Trans Maryland. I'm actually also a PhD student in counseling psychology at the University of Maryland at College Park, as well as Vice Chair of the Maryland Commission for LGBTQI+ Affairs. I also was once a page in the General Assembly, so it's really cool to be back here. Joy to be back in Annapolis, not wearing a gray blazer, unfortunately, but really excited nonetheless to discuss this critical bill. Since 2021, Trans Maryland here has worked with a team of researchers supported by funding from the University System of Maryland on a statewide assessment of trans community experiences across the state. In our recent report on identity documents released just a few weeks ago, we found that only 14.4% of trans Marylanders had their correct gender on all of their documents. Individuals with lower incomes, as well as individuals with disabilities, were significantly less likely to have their gender reflected accurately on their ID documents. Speaking also to the importance of X markers, respondents with X gender markers on their current Maryland driver's licenses or state IDs reported feeling significantly safer after changing their marker to X. Additionally, as a psychologist in training in my doctoral studies, I also know how stretched our healthcare system currently is. This bill will help alleviate unnecessary administrative burdens experienced by providers under the current law and allow us to open up appointments for people who truly need them. Accurate identity documents are critical for so many areas of everyday life. Also for me, as a non-binary person born and raised here in this state, birth certificates are what personally keep me from having fully accurate identity documents. These simple changes will help ensure more trans Marylanders can access documents that match who they truly are, with measurable impacts on safety and well-being for people like me and for communities across our state. I thank you for your time, and for these reasons, urge a favorable report.
Thank you, and you must be Kellen Sweeney.
Yes, ma'am. Honorable Chair Beidel, members of the committee, my name is Kellen Sweeney. I live in Baltimore City with my husband and my 4-year-old. As a parent, I regularly need to prove my identity and my relationship to my child. Because I am transgender and legally changed my name after giving birth, the name on my driver's license did not match the name on my child's birth certificate. This often caused confusion and uncomfortable and frankly invasive conversations. I could not find guidance on the State Division of Vital Records website for how to correct it. It was not clear what type of appointment to make. Mail wasn't an option because there were no forms. So I just picked an appointment type. I took a day off of work and I hoped someone would be creative and help me. It was not what happened, so I went home, I made a different appointment type, took another day off of work, and I had better luck on my second try. Accessing core government services like accurate identification documents should not be left to individual staff discretion, and it should not require taking multiple days off of work for a very basic update. By contrast, updating my driver's license was simple. The MVA website explained what type of appointment to make, what documentation to bring, the staff were trained, the systems were updated to collect the information. That is because the General Assembly passed legislation to make those expectations clear to the agency. You may wonder if this is really necessary. I would not have been able to update my marriage certificate were it not for House Bill 369 passed in 2022. To make a long story short, the marriage division at the Baltimore City Courthouse simply refused to accept my legal court order and update my marriage certificate. I was sent on a wild goose chase, 10 hours in the courthouse over 4 days, 2 buildings, civil division, family division, magistrate. No luck. I finally contacted the Attorney General's office asking how they plan to comply with the legislation. My marriage certificate was updated the next day, saving everyone the trouble of a civil rights lawsuit. Transgender Marylanders and their families deserve the same access to accurate government-issued identification as any other Marylanders. I urge a favorable report on Senate Bill 314.
Thank you, Kelly. Do I have any questions for this panel? I don't see any. Thank you. I see Senator Love has joined us. Do you want to come up to testify?
No,
She's the JPL
Okay.
observer.
Thank you. Thank you all very much. And we're going to call 5 more favorable people. Is he staying to testify?
Yes, he's on the next panel.
Sorry, he
Oh, I didn't.
jumped the gun, he didn't know.
I don't see his name.
Cooper.
Cooper. Okay, Cooper, do you want, let me bring up some more people and then you'll be the first one, okay? Lee Blinder, Sharon Blugis, Jeremy Browning, and Penelope Song, if you're here.
I'll yield my time. Lee Blinder.
Okay. Who was that? Who's?
Lee Blinder.
Lee Blinder, okay. Thank you, Lee. Joellen Fountain. I think I have room for 2 more? 1 more. Oh, wait. Okay. Cooper, we're going to start with you. Thank you.
Good afternoon, Senators. My name is Cooper Speech. And I am 14 years old, and I am an 8th grade student at St. Anne's School of Annapolis. I am speaking in support of simplifying the process to update birth certificates to provide enhanced protection for transgender and gender-expansive people. Senate Bill 314. I am here today as an advocate as I started work with the LGBTQIA+ community within our county and state as a part of my capstone project, working with the Coalition for LGBTQIA+ Students of Anne Arundel County. I want to clarify that this has been a passion of mine for several years, in which I have worked within my means at my school to support this community of individuals. I realize now more than ever we need and value the need and value of advocates to the LGBTQIA community. I am a middle school student and advocate. I also have family members and friends who are part of the LGBTQIA community. I have been a member of my school's Gay Straight Alliance Club when I worked with friends to determine ways within my school community to help and support other LGBTQ students. Even though most adults probably think teenagers, particularly middle schoolers, are self-consumed and not concerned with what is going on around in the world around them. This isn't true, at least for me. I am seeing this new administration and political climate trying to rid the world of diversity and the negative effect it is having on this community. I feel that it is not fair to just sit around and let people destroy who we are just because we are considered different to some people. This Senate bill is giving individuals the opportunity to, in one more official way, own their gender identity on official government documents such as license, birth certificates, and identification cards. This is one major way we can come together to honor those, or honor who these individuals feel they truly are. The LGBTQ community needs advocates and support more than ever. I hope to continue my advocacy beyond today and even my capstone. I hope you vote in support of Senate Bill 314 and be an advocate too. Thank you for your time and consideration.
Sharon Blugis, I hate to ask you to follow that, but you're going to be next.
Right, thank you. It was very good. So I'm going to make this a little shorter from what we had submitted online. But Deputy Director of Reproductive Justice, Sharon Blugis, Reproductive Justice Maryland supports Senate Bill 314 in keeping with our mission to champion reproductive justice as a fundamental human right for all Marylanders. We believe that everyone deserves the freedom to make informed decisions about their bodies, health, futures, and free from discrimination, coercion, and barriers. This includes the freedom to live without regard to oppressive and harmful notions of gender. In this moment in particular, and today has been an especially painful day in this country, Senate Bill 360 represents an opportunity for Maryland to stand firm against the federal government's all-out assault on transgender rights. Since the first day of the new presidential administration, we have seen the federal government attempt to erase the very existence of transgender and gender nonconforming individuals. All references to transgender and gender nonconforming people have systematically been scrubbed from the federal programs and at every government agency. This has been done to communicate the administration's message of intolerance to transgender and gender nonconforming Americans. We can and we must take an opposite stance in Maryland. This bill will not solve the problem of the federal administration's outright hostility towards transgender people, but this is a meaningful step that Maryland can take in this crucial moment. Something as simple as having one's driver's license or identification card reflect their true identity can be a lifeline in these dark times for transgender, nonconforming Marylanders. Reproductive Justice Maryland is proud to support Senate Bill 314 and urges a favorable report. And thank you, Chair and Vice Chair.
Thank you, Sharon. Jeremy Browning.
Good afternoon, Chair Vital and Vice Chair and members of the committee. My name is Jeremy Browning. I use he, him pronouns, and I'm the director of the Maryland Commission on LGBTQI+ Affairs. The commission was created in 2021 to assess challenges facing the community and make recommendations and best practices for inclusion. You have my written testimony, so I just want to emphasize a few things. The Birth Certificate Modernization Act is a top priority for the commission and represents a crucial step towards ensuring the dignity, equity, and inclusion for transgender, non-binary, and intersex individuals in Maryland. So I want to highlight that this removes longstanding barriers to and by streamlining processes for amending sex designations on birth certificates. It removes the unnecessary medically unnecessary burdensome requirements such as proof of surgery or other medical interventions that many individuals cannot access or do not want. In addition to this being a top priority for the commission, I want to emphasize that this has broad support from local and national advocacy groups. The NVA has reviewed the bill and has no concerns. The Maryland Department of Health supports this bill, and the governor supports this bill. So beyond the broad support and procedural benefits, this legislation would send a powerful message to LGBTQI+ Marylanders, particularly parents and youth, that their identities are valid and that they belong in this state. And passage of this bill is especially important right now, given the targeted federal attacks on our transgender communities. So with that, we respectfully urge a favorable report on Senate Bill 314.
Thank you. Penelope Penelope Song.
Thank you very much, Chair, Vice Chair, Committee, for allowing me to speak. My name is Penelope Claire Song. I was born Jason Scott Fitch, male, August 24th, 1986 in Silver Spring, Maryland, to Daryl Lynn Fitch, my amazing mother who was disabled her entire life. And this bill is important to me. It's very personal to me because living in Maryland has afforded me opportunities that no other state would allow a person. And Maryland has given me many second chances. I dropped out of high school. Maryland was there to get me my GED. I needed to jumpstart my associates. Maryland was there to give me access to the Bill and Melinda Gates Foundation Gateway to College. I struggled because I was struggling with a personal journey inside myself that I did not know I was undergoing. And my apologies, it's my first time publicly speaking in a while. And I urge the committee to not only pass it for people like me who feel like they've been given a second chance knowing who they are, but also for people that are still struggling, whether or not in this climate to make any further changes, whether or not they should be able to pursue who they are, to have that pursuit of happiness that we are guaranteed in this Constitution. And it is also important because it allows clarification for our ability to travel from state to state, and it also will probably give clarification regarding the application of passports in the future regarding the uncertain climate. And I want to be very clear that this bill does not make it easier for convicts or supposed bad actors to take advantage of good legislation for good people. I can attest to this because this process is not easy. It is not an aesthetic. It is not something that you just wake up and decide, oh, I'm going to try it out one day. It's something that weighs heavy in your mind, and I urge the committee to vote favorably for this bill. Thank you.
Thank you for your testimony. And the last person is Joellen. Thank you.
Good afternoon. Chair and Vice Chair and members of the committee, thank you for this opportunity. I'm here as a constituent, as a member of the Christian faith, which often is posted against the LGBTQ community. I'm an ally of the LGBTQ community. I work with Annapolis Pride, but I am not here on behalf of Annapolis Pride, who submitted separate testimony. I'm here as an individual. I'm also the mother of a trans adult. And this legislation is essential. Many trans people, and my son among them, have focused on their federal documents, and they're now at risk. And the ability to change your birth certificate and not have prior evidence of a pre-existing birth certificate could be very protective to people right now. My son has waited to get his birth certificate because he thought he was covered with a passport and a social security number. As Annapolis Pride has done a name change event, I learned how archaic Maryland's process for name changes and gender changes has been. My son, born in Virginia, has a much simpler process. And I encourage each of you to consider the needs of the people right now who are threatened and are at risk. And I can't say as well as the previous person about what it means for parents. As a parent, I know you take your child's birth certificate everywhere, and if your name isn't the correct one on it, it would be humiliating for you, for your child, could out parents to people who might not be supportive. There are many implications of this, and I encourage you to favorably support this bill.
Thank you. Do I have any questions for anyone on this panel? Seeing no questions, that ends this panel. Thank you very much for your testimony. I have two more favorables, Chloe Kastner and Douglas Hill.
Douglas can't be here.
Thank you. Chloe, I didn't want you up there by yourself, so I was waiting until I could call two people, and now you're by yourself. I'm sorry.
No, that's okay. I appreciate the time and consideration.
and thank you for hearing my testimony on the bill. This is my first time here, so it's nice that I get the road to myself. I've been debating how to talk about this, but I think the most important thing is framing it from the perspective of we've had a lot of really brave and established trans people come up today to speak. And that's a really long, drawn-out process. There was a lot of small micro steps in my transition in my life that would have gotten me to this point. So whenever something like this comes up, I try to frame myself back to day one. And day one, things were very difficult. There was a lot to learn. There was a lot to understand. I was very lucky to have resources like Trans Maryland that can compile that and assist us with that. But in my fieldwork, I'm a student at the I'm a student at the University of Baltimore in the Masters of Social Work program. And I see every day families that don't have resources spending money on taxis, spending money on lifts, and having to make new appointments and continue to deal with challenges with the different departments and divisions we have in the state. And this is a way that we can address that. It brings the birth certificate process in line. What you've heard today from many people on the panel is that these changes happen, but sometimes it takes luck. And I think everyone in this room would agree that we don't want a state policy or procedure to be based on luck. So the purpose of a birth certificate is simple. It's to identify who you are. And I believe this bill gets us a step closer to that. And I do urge you to vote in support of this bill so that we can protect all Marylanders and not just most Marylanders. Thank you.
Thank you for your testimony. Do I have any questions from the senators for Chloe? I don't see anything. Thank you. Thank you for your testimony. Madam Manager, who do we have with us on virtual? Greg Kameh, are you there, Greg? Okay. And then Jeffrey Trimbath. Is Jeffrey there? If you're there, will you please unmute? Turn on your camera and unmute.
We're here. We're in here.
Oh, I'm sorry. I thought, my apologies. I'm having a rough day today. I'm sorry. Thank you, but come on up.
Good afternoon, Madam Chair and members of this committee. I am Reverend Dr. Greg Kameh, and I serve as the senior pastor of Glen Burnie Baptist Church and a member of the Christian Life and Public Affairs Committee of the Baptist Convention of Maryland and Delaware. I'm here today to voice my strong opposition to this Senate Bill 314. When Lord Calvert founded Maryland in 1634, he established the moral and legal foundations of the state on Judeo-Christian values, which, according to recent studies, these values are still upheld by over 60% of Maryland's population. Now, this suggests that most Marylanders still uphold to a binary understanding of sex, which is rooted in the biblical teachings as clearly expressed in Genesis chapter 1, verse 27. It says, God created mankind in his own image. In the image of God, he created them, male and female, he created them. Introducing a third option for sex, in addition to male and female, raises three main concerns for most Marylanders, especially within the Christian community. First, it undermines God's intentional design for humanity. Second, it places undue pressure on Maryland's Christian community to accept a definition of sex that contradicts our deeply held convictions. And third, it overlooks the primary purpose of birth certificates, which is to establish a person's identity at birth. For these reasons, I urge that you vote against this bill.
Thank you, Reverend. And Jeffrey?
Good afternoon, Chairwoman Beidel and members of the committee. My name is Jeff Trimbath. I'm the president of the Maryland Family Institute. I'm here today to testify against SB 314, which proposes changes to birth certificates, allowing individuals to designate their sex as unspecified or another. This bill promotes an ideology that contradicts biological science, could harm the treatment of medical emergencies, and disrespects mothers. Birth certificates are not subjective statements of identity. They record objective facts, including an individual's sex, which begins developing in the womb and is an unchangeable aspect of personhood. One's gender may be mutable, but one's sex is not. Redefining sex with a subjective psychological option, such as unspecified or another, will create confusion in medical emergencies where sex-specific treatment is required. Many Maryland families are concerned about the rise of policies that promote radical gender ideology, especially when they conflict with biological reality. Governments across the world are abandoning these radical policies after seeing the harm that they cause, especially to our young people. Maryland should learn from this and avoid making the same mistake. One final note. In 2 places, this bill literally erases the word mother from this law. I don't know about any of you, but I loved my mother. I love the mother of my children, my wife Jill, and I love the future mothers of my grandchildren, my daughters Kate and Sarah. The job of motherhood is difficult enough today, and Maryland's laws need to do all that they can to support and celebrate this most important and sacred task, not erase it. I urge the committee to reject this measure and instead pursue policies that respect biological reality, immutable sex characteristics, and mothers. Thank you.
Thank you, Jeffrey. Do I have any questions for this panel? Senator Reedy.
Chair, Mr. Trimbath, a couple of points you're making. I'm sitting here listening to the testimony on both sides. I keep coming back to, on the birth certificate thing particularly, gender expression, we're told, can be fluid, can change. And folks that are maybe non-binary or classify themselves as non-binary, they don't feel like they're either male or female. But sex is different than gender, correct? I mean, is that basically the basis of your argument? Like for a birth certificate, that says what you were when you were born. And so if you now believe that you feel more comfortable presenting as a woman when you were biologically born a man or a boy, so it seems like this bill ought to maybe be broken into a couple different parts, because if somebody wants to have a driver's license maybe that says one thing, it's a little different because that's how they're presenting themselves versus a birth certificate, although I would maybe question the security issues of a driver's license as it relates to the Real ID Act and some of those other things. That's kind of in the weeds. But I mean, can you just talk about your feeling on the, like, birth certificate really should be a factual statement of what happened in 1985 or 87 or 95 or whatever. I mean, can you just speak to that?
Yeah, I think it's a great point. And you've heard a lot of talk today by the previous panels of the word gender. I didn't do a formal word search of the bill. I don't think that word even appears in this bill. This is a bill that will redefine the term sex with regard to birth certificates. Gender may be one thing that's mutable. Sex is not. Sex has to do with gamete production of the human being. And the federal executive order that just came online a couple of weeks ago actually mentions this. This is how we define sex. And so that's one of the concerns that we have about this. It's not about gender. This is about redefining sex in the law. And we think that's very confusing.
Thanks.
I see no further questions. Thank you to this panel.
Thank you.
Now we're going to have our virtual witnesses. Emily Shaw.
Hello, Honorable Chair Beidel, Honorable Chair, Vice Chair Hayes, and members of the committee. My name is Emily Shaw, and I'm a resident of Montgomery County, and I am a mother who very much loves this bill. In my day job, I manage data. As someone who is aware in both my professional and personal life how critical it is to have accurate information in order to access services and even our rights, all Marylanders deserve clear, uncomplicated paths for correcting key official documents. I therefore strongly support Senate Bill 314, and I'm seeking your committee's favorable report without amendments. In Montgomery County, I have a child who attends MCPS. We registered for school in Bethesda 10 years ago. In order to register for school, parents are asked to show a birth certificate. The birth certificate confirms a child's relationship to their parent who's resident in the district, enabling the schools to confirm their eligibility. It is possible to find a way around using a birth certificate, for example, by going and getting a court order, but I have my family's birth certificates in a box in my house, and I don't have any court orders. Our birth certificates are the central tool we use to show the relationship between children and parents and all the resources and benefits that come from that relationship. Meanwhile, for the individual owning the birth certificate, that document is also our country's fundamental statement of their citizenship. We don't get citizenship certificates when we're born here, we have birth certificates. In a time when rights to citizenship are under a lot of pressure, it is essential that we allow people to make their birth certificates accurate. For people who change their name or documented gender, there can be serious consequences for having mismatched identity documents. First, having an inaccurate birth certificate can cause serious complications in hiring. At the federal level, the SAVE Act is likely to be brought back. If made law, it will bar people across the US from voting unless they show proof of citizenship, which if you don't have a passport, is your driver's license and a birth certificate. Mismatched information will cause the loss of a fundamental right. Bureaucratic records and the systems that hold them have a lot of impact on our daily lives. Marylanders deserve a clear way to update their birth certificates to prevent serious consequences. I respectfully ask for a favorable report on Senate Bill 314. Thank you.
Thank you, Emily. Do you have any questions for Emily? No, that's it. Thank you, Emily. And now I have Liz. Is that Liz? Liz Hammond. Hi, Liz.
Hi, can you see me?
I
Hi.
can see you and hear you.
Good afternoon, Chair, Vice Chair. Appreciate you letting me speak today. I'm here from CARY, Community Allies of Rainbow Youth, which is an organization in Howard County that works closely with the Howard County Public School System. Please, for the record, mark us as favorable on this bill. We think it's crucial. Everything that I could say to argue for it has been said. I've been listening, and all of the speakers have been fabulous, so I don't want to take up any more time than is necessary, other than to say that for the opposition, it's okay if it's confusing, and it's okay if people don't understand. You don't have to understand something to accept it, and you don't have to understand something to do the right thing. So let's take that narrative about it might be confusing out of this, and let's just do the right thing. One of the things I've learned in activism over time is that when a marginalized community tells you what they need or what they want, then your only job is to get up and help them get what they need or what they want, not question it, not pick it apart, not try to figure it out. So let's respond to the need. Clearly, we are being told that the need is there. Let's dignify the humanity of this marginalized population in Maryland. Thank you very much.
Thank you very much, Liz. Any questions for Liz? No questions. Let's go to Ezra Town.
Chair Beadle, Vice Chair Hayes, and members of the Finance Committee. My name is Ezra Town, and my pronouns are they, them. I'm an out transmasculine non-binary person, a spouse, a leader in my trans community, and a parent of 2 children ages 12 and 17. I wasn't always named Ezra, and before I became a parent, it didn't really matter to me what it said on my legal document. But once it became time to enroll my oldest child in school, I could no longer handle the dissonance provided by caused by having a name that I went by and a legal name that didn't match it. But as you know, this didn't solve the problem of my name on my children's birth certificates. And as such, my children have incorrect identity documents. Each time I need to prove my parentage, I have to bring along my name change paperwork. Not only is it an additional burden to have to bring that paperwork along, it is extremely distressing to me. Ezra is my name, and it feels as though it always has been. It's discriminatory towards me and to other trans and non-binary Marylanders for us to have to provide this additional information. Currently, there's no clear path for trans and non-binary Marylanders to update their the birth certificates of their children, and SB 314 would change that by making that possible after an order of legal name change is granted by the Maryland courts. It is for this reason that I provide favorable testimony for SB 314 and ask you for a favorable report out of committee. Thanks.
Thank you for that testimony. Do I have any questions for Ezra? I see no questions. Thank you very much. And last, we have Josie Caballero.
Yes, thank you so much. I'm Josie Caballero. I am honored to speak today on behalf of Advocates for Trans Equality. I'm also a Maryland resident in Montgomery County and serve as the Policy Committee Chair of the Maryland Commission for LGBTQ Affairs. Advocates for Trans Equality fights for legal policy rights of transgender people in America. Advocates for Trans Equality works at federal, state, and local levels to educate lawmakers about trans people's lives and experiences, to promote laws and regulations that protect trans people's rights, and fight back against anti-trans laws and policies that seek to harm trans people and push our communities out of public life. On behalf of Advocates for Trans Equality, we strongly support Senate Bill 314, the Birth Certificate Modernization Act. This bill is critical to the safety and dignity of transgender, non-binary, and intersex individuals in Maryland. This bill addresses long outdated requirements to create better processes for amending sex designations on birth certificates, licenses, and identification cards, critically removing unnecessary requirements such as proof of surgery and other medical interventions. As someone who was born in Texas, this is a huge burden on my own representation. Current requirements are not only outdated, but harmful to the trans and non-binary community. Simplifying this requirement of this bill is more in line with the needs of trans individuals and lived reality of their identities. This also aligns with best practices and recommendations by medical and advocacy organizations nationwide. Senate Bill 314 also allows Marylanders to choose an X marker on their birth certificates, which would set Maryland ahead with 16 other states as well as Washington, D.C. that allows this process to happen. This bill is not about paperwork. It's about dignity and belonging for the LGBTQ Marylanders in this state. So we are urged that we vote favorably on Senate Bill 314. Thank you for your time.
Thank you, Josie. Do I have any questions for Josie? Thank you very much. So this ends our hearing on Senate Bill 314. It ends our hearing for today, and thank you very much for joining us. Thank you, Senator Love, and thank you, Senator Jackson.